Pleasant morning to all of you and welcome to the Shangri-La Hotel Jakarta, Indonesia on the occasion of Indonesia-China Healthcare and Biotech Investment Forum. Please give a big round of applause to all of us today. Thank you. Welcome to the heart of Jakarta where the hotel is located and hope it greets you a warm welcome in this beautiful morning. It is really my great pleasure to welcome all of you here. My name is Taufik Effendi and it's an honor for me to be your MC today. We are pleased that all of you are able to join us in person today to discuss further the productive collaboration between the two countries, and we do hope that you enjoy our hospitality. Indonesia and China has maintained good collaboration for a long time in many sectors, including health sector. I believe that we are moving in one direction to the more accessible healthcare and biotech. Therefore, today we all gather in this room to create new milestone in Indonesia and China's healthcare. So, Excellencies, distinguished guests, ladies and gentlemen, to kickstart today's event, without further ado, I would like to welcome Deputy Minister of Pharmaceutical and Medical Devices, Dr. Rizka Andalusia, to give her remarks. Dr. Rizka, the stage is yours.
Excellency Bapak Budi Gunadi Sadikin, Minister of Health of the Republic of Indonesia, distinguished participants from Embassy of the People Republic of China in the Republic of Indonesia, Mr. Jafar from Legion, and all the CEO, President, Vice President, Director from China Company, and also the senior officer from Ministry of Health and Indonesia FDA. Distinguished participants, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Very good morning to all of the participants. It is a great pleasure for me to welcome to you to Indonesia-China Healthcare and Biotech Investment Forum 2024. I extend my warm welcome and thanks all Indonesia and China delegation to attending this event. Your presence today emphasizes the importance of working together for brighter and healthier future for our citizens. Along with that, I am reminded of a China proverb that beautifully resonates the importance of working together rather than work alone as what we will embark through this event. Maybe I'm not correct with the pronunciation. Ju mu bu cheng lin Dan Xian Bu Cheng Yin means a single tree cannot make a forest and a single string cannot make a music. Excellency, ladies and gentlemen, it is our endeavor to progress the steps taken to enhance national health infrastructure through 6 pilot of health system transformation. This strategy encompasses primary healthcare, secondary healthcare, health system resilience, health financing, health talent, and health technology. Although several progress has been achieved in the last 3 years, we still face some gaps in providing innovative vaccine, therapeutic, and diagnostic, and building the health system resilience, which may be turning into an opportunity to collaborate with the partner. More experience in research and development, including clinical trial, more advanced production technology and product, utilizing digital system information, enhancing capacity of human resources, strategic investment, and developing digital health solution to bring geographic gaps and enhance service delivery are some of the gaps to be filled. Funding is also one of the challenging factors to provide innovative vaccine, therapeutic, and diagnostic and implement high technology system. As we learn from the successful story in China in transforming their healthcare and life science product ecosystem through 4 reformative action, enlarging health insurance coverage, reforming drug approval mechanism, incentivizing research and development, and involving venture capitals. We believe Indonesia will reap the same success by working together according to this nation's values, priorities, and policies. Ladies and gentlemen, following the successful event held in Chengdu on July 2023, we would like to proudly present Excellency and distinguished participants the event Indonesia-China Healthcare and Biotech Forum 2024 that will be starting today. This event will provide an opportunity for Indonesia and China healthcare and biotech company to meet, explore, and find potential collaboration to enhance healthcare services and healthcare resilience in this country. We are delighted to welcome the China delegation facilitated by China Embassy in Jakarta and Legend Capital that comprises 25 companies with backgrounds in vaccine, biopharmaceutical, medical devices including IVD, digital health, supply chain, and capital. I would also like thank to 26 selected Indonesia company. Actually, more than 100 Indonesia company wants to join this event, but because of the capacity of the room is not enough, so we selected 26 Indonesia company that join us in this forum. Through this event, we will provide an interactive discussion between company, seminar and regulators, networking session, and site visit to leading Indonesian hospital, pharma, biotech, and medical devices company. I believe this will be an excellent opportunity to contribute progress in our work to transform Indonesia healthcare. Pak Menteri, in this table, we mix Indonesian company and China company in the same table, Pak. Excellency, ladies and gentlemen, I would like to thank Legend Capital who have worked together with the Ministry of Health to set up this forum. And to conclude my remarks, I would like to invite Excellency Minister of Health, Bapak Budi Gunadi Sadikin, to convey his valuable speech and provide guidance to all of us in this wonderful morning. Thank you.
Thank you, Dr. Rizka, for your remarks. And moving on, ladies and gentlemen, I would like to welcome the Managing Director of Legend Capital to give his remarks to Mr. Jafar Wang. The time is yours.
Dear Minister Budi Gunadi Sadikin, Dr. Rizika Lucia, ladies and gentlemen, good morning. I'm Jafar Wang, Co-Chief Investment Officer of Legend Capital. I'm very happy and pleasure to have this opportunity to give a speech here, and thank you again for coming. 10 months ago, in last March, I visited Jakarta for the first time. It was my great honor to be received by the Minister Budi, who gave us share with us his vision and a development plan of Indonesia healthcare systems. I was deeply encouraged and excited. As the fourth largest population in the world and one of the most promising emerging markets, Indonesia market obviously has huge potential in the healthcare sector. Historically, US and European pharmaceutical companies have not been active enough in this market, which led to a great amount of innovation drugs and medical device absent from Indonesia, or priced too high, which means like the global pricing for the registered product. But this is the very great opportunity for Chinese companies. In the past 20 years, Chinese pharmaceutical and medical device companies have gone through the development circle of copy, follow, innovative, and to surpass. Today, more and more Chinese companies can provide quality products and affordable price for emerging markets. And they are quite open-minded when it comes to collaborative mechanism, including the product trade, technical transfer, joint venture, and fully localized operation. Founded in 2001, Legend Capital is one of the most active venture capital firms in China. Our asset and management is more than 11 billion US dollar today. We started into investment in the healthcare sector since 2007. Over the past 17 years, we have invested 3 billion US dollar in more than 170 portfolio across different sectors. In 2020, we decided to expanding our coverage outside of China and starting our strategic presence in Southeast Asia market. The first investment was made in Indonesia. We are not only an investor of Etana, but also a very important strategic partner. And in the past 4 years, we have made a series of the investments here and become the most active Chinese venture capital in Indonesia. I would like to thank Nathan for this help. It's through his network, we established collaboration with many outstanding local business partners. And also Nathan built up very close relationship and a partnership with the Chinese companies together. Thanks, Nathan. And at the same time, we are also seeing more and more Chinese investors and even international institution and financial institution start to pay more attention to an investment in Indonesia and the broadened Southeast Asia market. We are expecting more to come. Last July, during the university side, President Joko Widodo visited Chengdu. As Minister Budi suggested, we organized the first China-Indonesia Healthcare Investment Summit, which was attended by nearly 100 Chinese and Indonesian companies. The summit was a great success, and the Minister Budi suggested we should hold a similar meeting in Indonesia and to invite a Chinese company to visit in Indonesia, get to know Indonesia, and invest in Indonesia. That's why we are here. Today, we have quite a lot, but not enough company and a financial institution join this meeting today. And I believe many more business collaboration could be generated from this meeting. On behalf of the Chinese participants today, I would like to express my thanks to the Ministry of the Health of Indonesia and Minister Budi, Dr. Rizka. I would like to use the 3 keywords to summarize my vision of the bilateral collaborations. The first keyword is wide range. We believe that the future cooperation between China and Indonesia healthcare sector will be very extensive, not only in product-based areas such as APIs, innovation drugs, and medical device, but also in service-based areas such as the clinical CRO, digital health, and service and medical service. Let us work together to refine and strengthen the infrastructure of the Indonesia healthcare sector and build a healthy, consistently, and orderly market. The second keyword is openness. We need to promote all-round cooperation with an open-minded. On top of the product trade, we need to put in more efforts in technical license and transfer, and local operations through joint venture. The third keyword is win-win. Our cooperation aims to promote development and progress for both sides in the long run, and not just for the benefit of one side. So wide range of cooperation, openness, and win-win. The first letter of the 3 keywords gave us a new word, wow. So we believe that under the leadership of the Minister Budi, Dr. Rizka, with the efforts of both sides, our cooperation will generate more and more pleasant surprise in the future. Thank you.
Thank you, Mr. Jafar Wang, for the remarks. Ladies and gentlemen, it is indeed a wonderful opportunity to witness this important collaboration, an important milestone where the collaboration will create something for the future of healthcare and biotech. So now I would like to invite to the stage for the first agreement for local production and technology cooperation of IVD between PT UBC Medical Indonesia, PT Esora Medica Indonesia, and Sansure Biotech. So to represent PT Esora Medica Indonesia, I would like to invite Mr. Franciscus Saverius Joshua Raincung to please come on stage. And also Director of PT Sansure Indonesia, Mr. Samudra. And I would also like to invite for the second agreement for further cooperating on the commercialization, development, and transfer of technology of tislelizumab product between PT Etana Biotechnologies Indonesia and Beijing. I would like to invite President Director of PT Etana Biotechnologies Indonesia, Mr. Nathan Tirtana, to please come on stage. And also President, Chief Operating Officer of Beijing, Mr. Adam Roach, to please come on stage as well. Thank you, gentlemen. And now I would like to invite His Excellency Mr. Budi Gunadi Sadikin and Dr. Rizka Andalusia to please come forward to the stage to witness the signing ceremony. All right, ladies and gentlemen, I will start the countdown from 3 and we can start the signing ceremony. Ladies and gentlemen, the signing ceremony starts on 3, 2, and 1. Please exchange the agreement for both parties to be signed as well. The signing is done. Please give a big round of applause for both parties. And please stay in the stage for the photo session. Please move forward to the front of the table. Thank you very much to all the representatives. You may now return to your seat. Dan untuk Bapak Budi, kami mohon kesediaannya untuk tetap berada di panggung dan lanjut dengan memberikan sambutan pada pagi hari ini. Ladies and gentlemen, I would like to welcome Minister of Health of the Republic of Indonesia to give his keynote speech to His Excellency Mr. Budi Gunadi Sadikin. The stage is yours.
Ladies and gentlemen, good morning and wow. Wide range, openness, and win-win. We call it Chengli in Chinese. So you win, I win. Not you win, I lose. So ladies and gentlemen, health sector play a very significant role in our country development and ambitions to be high income countries. The president told me it's by 2045. And to reach the high income countries, we have to make sure that our people are healthy and smart. Because otherwise, the income of our people will not be able to push the GDP of our country to become a high income country. So Indonesia at $4,700 per capita per annum, we need to boost the numbers to 13,000, which is the minimum level of high income countries. And in the history of nations across the world, the biggest chance for a country, the biggest windows of opportunity for every country to migrate to high income country happens during the peak of their demographic bonus. The logic is very clear because during demographic bonus, the percentage of productive populations is the highest in every country. And after that period, after that windows of opportunity, after that time windows, then the populations of every nation start aging. That's why the percentage of productive populations decreasing. Then it would become more difficult for any nations to break the barrier of high income countries. And some of the countries that we have seen passed this demographic bonus and they didn't get a chance to break the high income country status and they are trapped as a middle income countries. We in economy call it a middle income trap. The peak of demographic bonus in Indonesia will happen at 2030, 6 years from now. And we have around 5 years to realize that opportunity. So between 6 and 11 years from now, if we fail to break the 13,000 GDP per capita, then that is our biggest sin to our children and the children of our children, that Indonesia will never be able to be categorized a high income country. And our next generation will not be able to live in a high income. So that's why we have to make sure in the next 6 to 11 years, we have to be able to triple our GDP per capita or our average income per capita to reach this status. So if we want our son and daughter to triple their income of the fathers, the formula is very easy. Our son and daughter should be healthier and smarter than us. So that's why the role of the health ministers and education ministers are key in the next Indonesian government. Because if our children are not smarter and not healthier than us, then it is almost impossible for our generations to push Indonesia to be a high income country. Not talking about healthier, which is our role in this room. From my perspective, healthy, the job of the Minister of Health is to provide good access equally. So whether he lives in the city, he lives in the villages, he lives in island, remote island, or big islands of Indonesia, you have to have good access. And second, you have to have a good quality of healthcare services and also good price. Especially as a banker, I would like to make sure that 280 million of Indonesians have good access, good quality, and also good price. And to do that, from the perspective of the government, we already, almost 9 solve the demand side issues by having BPJS. Our National Health Insurance Scheme is a single national health insurance scheme that covers more than 260 million of Indonesians. So now they have the capability. It's still limited because it is covered by it is determined by the government budget. But at least 260 million of Indonesians now can come to any healthcare facilities, primary care or secondary care, and ask for free, healthcare services. So at least on the demand side, it's being partly solved. And with the growth of our economy, with the growth of our national budget, then we can increase the coverage. We can increase the quality of healthcare services. But the mechanics was established. The problem that we have now is on the supply side of the equations. Because this 267 million population come to the hospitals of primary care, then the facilities are not ready. The doctors are not there. We need to travel so far to get access to these facilities. Even if we go to that facility, the standard is much below the international standard. So we at the government realize we need to fix in the next 5 to 10 years on accelerated basis the supply side of the equations in this healthcare sector to make sure that our children are healthy. So to make sure Indonesia can break this 13,000 per annum per capita. That is the reason why we are investing a lot. We are procuring like CT scan, mammogram to 514 hospitals in the 514 cities. We procure 10,000 ultrasound. We will procure another 10,000 EKG to 10,000 puskesmas in 10,000 districts that we have across the 17,000 island. We will make sure that we will equip all these 10,000 puskesmas with necessary basic labs like hemato analyzer, blood chemistry analyzer, the urine analyzer, so they can do a more active preventive uh, actions. We launch our increase our antigen of vaccinations from 11 to 13 and distribute this vaccine to be used by 300,000 posyandus across this 17,000 island. So massive deployment to fix the supply side of healthcare services, both promotive and curative, are being there. We secured a 4 billion loan from the World Bank syndications to make sure that we can buy enough cath labs, brachytherapy, LINAC, all of those expensive machine MRI to be implemented across 514 cities. And that is the beginning. It is not the peak yet. Because when I'm talking about 514, that means the 514 government hospitals. But actually we have 3,200. So if we increase the standard on the supply side of the healthcare services from the government, which is usually the lowest, then the private sector will have to catch up. And when the private sector will have to catch up, their hospital size of the business is 3 times the government facilities. So if you start, participating in our bid now, actually the potential is 3 times bigger. Because this is just the beginning. The 4 billion is just beginning. It's like a bootstrapping to increase the minimum standard quality on the supply side of the healthcare services. So, ladies and gentlemen, the government are very keen and very determined to increase access, quality, and affordability of our healthcare services. And I think this is the right time for you to come. I mentioned in dinner last night that Indonesian spend only 140 healthcare costs per capita per annum. The outcome is 72 years old. Our closest is Malaysia, 76 years old. They spend 300 US more. Singapore, 84 years average life. They spend 2,800, one of the most efficient in the country. I believe, if I'm not mistaken, China is 76 with 560 or 400, 500 more than Indonesia. So if we are moving toward Malaysia in the next 5 to 10 years, for you all companies owner, from 72 average life to 76, I'm going to be 60 this year. 60 is categorized as elderly in Indonesia. You start getting free on everything, lifetime on driving license, lifetime on national identity numbers, discount on airline tickets, discount on everything, because they don't believe that I can live long. But of course, I'm expecting to live longer, hopefully more than the average life of Indonesian, which is 72. If we move to Malaysian level 76 in the next 5 to 8 years, then our healthcare expenditure will increase by 300 US. You multiply by 280 million Indonesian, that will be an 80 billion US upside opportunity. If we move to Singapore level in the next 10 to 15 years, we will add 2,700 additional homes. Multiplied by 280 million, that will be 700 billion-ish upside opportunity. For you investor, usually when you invest, you always look for where we can buy low. And the opportunity to move high is very, very prominent. I think this is the right place to go. Because it's start very, very low. Opportunity to grow is very high. Our growth is very good. The political stability is also very good. So I think this is the right time for you to come, to invest, and enjoy the potential upside. So again, for any Indonesian companies, we need access of technology so we can get good quality of products and also with a cheaper price for our people. This is also the time for you to get to know your Chinese friends. Because in China, I've noticed they have a amazing, progress in terms of healthcare sector, So I would like to replicate this into Indonesia. And I think the fastest way is to be together, So good luck again. Thank you, and looking forward to see a fruitful business venture among all of you. Thank you.
Thank you very much to Minister of Health of the Republic of Indonesia, His Excellency Mr. Budi Gunadi Sadikin, for his speech, and also thank you for your presence in this event. Terima kasih kepada Bapak Budi Gunadi Sadikin, Menteri Kesehatan Republik Indonesia, atas kesediaannya untuk hadir pada pagi hari ini di acara kita bersama Indonesia-China Healthcare and Biotech Investment Forum 2024. Sekali lagi terima kasih kami ucapkan kepada Bapak Budi Gunadi Sadikin, Menteri Kesehatan Republik Indonesia, atas kesediaannya untuk hadir. Selamat melanjutkan aktivitas, Pak, pagi hari ini. And we will continue today's event as we have witnessed the signing agreement before, and also we have seen all the speeches delivered. Next agenda, I would like to invite our colleagues from Legend Capital to deliver about evolution of China's healthcare. To Mr. Frank Hong, the stage is yours.
Good morning. I'm Frank Hong from Legend Capital. Today, my sharing topic is the evolution of China's healthcare. Next. In the past 20 years, there are a lot of changes in China in healthcare sectors. Especially, there have many reasons. Of course, most important reason is the increasing population of aged people. In this picture shows that the population aged over 65 years old will account for 50% of the whole population and will reach 240 million. In addition to the increasing population of aged people, we think that another is the health expenditure per capita in China has increased from $53 in 2000 to $752 in 2020. So even the healthcare expenditure per capita in China is relatively lower than any other developed countries. But combined with the whole population of China, the whole healthcare expenditure is still very high and increase so fast. Next. China's biopharma industry recently increased so fast. Especially China has this is the case, has account for the 25% of the global biologics market. Also, China Biotech has played an important and key role in the global. For example, for example, China contribution to global innovative clinical stage pipeline is up from 4% in 2016 to 17% in 2021. Another example is China has become the second largest country of origin globally by markets of all the biotech IPOs since 2015. So China's biopharma industry changed a lot. This slide is very interesting. It happened like last year. In 2023, the China's biotech BD deals in 2023. The total number of the deal was 124. And within China means the domestic deals is 50 deals. Licensing deals means the Chinese some biotech licensing some deals from the ex-China was 21. And the license out deals were 53. This is the first time that the license out deals exceed the license deals. And about the size of a deal, the total license out deal size is about the 42.6 billion US dollar. And the licensing deals is 4.3 billion US dollar. This is a huge gap of 10 times. And especially in ADC field, over 40 deals are ADC for totally 24.7 billion US dollar. So this is a very, very proud of thing that it is indicating that the Chinese biotech R&D level reached the global standard and also fully recognized by the global MNC. So I think this is a very important milestone, especially happened in 2023. There are four key drivers accelerate the Chinese healthcare evolution. The first one is policy. The second one is registration. The third one is the industry operation. The fourth is about the venture capital. So about the policy, by the end of the 2019, 1.35 billion people have participated in the Capital National Basic Medical Insurance with coverage ratio of 95%. And till now, the whole coverage insurance, national insurance coverage has basically completed. Also, the government introduced a lot of the policy to support the companies' innovative operation, especially like the drug procurement, with the target quantity forces companies to focus on the R&D again. Means in the past, a lot of the Chinese genetic drug only focused on genetic R&D, but this policy just push some Chinese genetic drug companies to operating and operating. Another is the accelerated local import substitution. The third is the dynamic adjustment of the national drug category. The second driver is the registration. Also, Chinese FDA has introduced a lot of policy to quickly approve some innovative drugs to meet the international standards, also to meet the Chinese unmet medical needs, like accelerated approval for the new drug, consistency evaluation of the genetic drugs, and also carry out priority review and the whole system in line with the international standards. Also, MH system optimize the resources allocation. Also, the Chinese FDA has joined the ICH and want to fully align it with the international standards. So that is why the Chinese FDA has improved the China's innovative drug to hope to meet the global standard. You know, especially the number of the approved drugs with the global popular targets, a lot of. Just for example, PD-1, GLP-1, BTK, JAK, CDK, IL-17, PARP, PCK9, PCSK9, and so on. A lot of the very popular and hot the target drug as approved in 2020 and even recently. So diversified new drugs are available for the Chinese patients. That's very important and quickly approve some new drugs and also including a lot of the very hottest and popular the targets quickly approved in China. You know, another of the factors accelerated the industry development. A lot of factors give the Chinese the whole industry operating. The first important is the talents. You know, a lot of the Chinese the scientists started and worked in US, in Europe, and in Japan. They just back home, back to China, and start up their own business. Also, they bring back a lot of the new technologies, like the cell therapy, gene therapy, a lot of the new technology platform back to China. And also Chinese government encourage and stimulate the entrepreneurship and hope and help them to start up their own business. So a lot of the factors accelerate the industry development in China. Okay. This is an example. You know, from the traditional therapeutic perspective, you know, it's a very large gap between China and other developed countries, like the small molecule drugs. But recently, the Chinese, the Chinese, the whole technology upgrade quickly, especially quickly upgrade to a biological medicine like antibody and NGC. I mentioned before, last year, the Chinese, the ADC, the deal licensed out to the outside China is about the 25 billion US dollar. So it can show that the advantage of the Chinese the biological medicines the ability. Also recently upgrade to advanced the technology like mRNA, RNAi, gene therapy, gene editing. So the gap between the China and the developed country become the smaller and smaller. So that's why the innovative tech upgrades quickly in China. This picture shows that the total investment amount and cases in healthcare in different countries since 2011. The US has invested 320 billion US dollars from 2011 to now. And China has invested 170 billion US dollars in the past 10 years. Even China has the big gap between the US and China, but also it's much higher than any other countries. So venture capital is very important, like Leading Capital. We provide a very strong financial support for the healthcare startups. Not only the private market, right? also including the stock market. In China, multi-level capital market support, like such as the A-share market, support innovative the companies coming to the public market, also including the Hong Kong exchange market, like Chapter 18, provides the more options for innovative drugs and medical companies. So stock market reform benefits for innovation healthcare companies. There are a lot of drivers and factors make impact on the China's healthcare evolution. The first is the policy I mentioned before, both the coverage and the government payment increase. The second is the registration. Registration policy encourage Chinese government and the Chinese FDA just introduce a lot of policy to encourage the innovation. The third is about the industry. The multi-factors stimulate the industry development and operation. The fourth is capital, including the venture capital, boost the startups, and the public market provides dividend. So this is a summary of the Chinese healthcare evolution. The next part, I will quickly to introduce about the Legend Capital Healthcare. Legend Capital was established in 2001 and with a team of the 150 professionals. Currently, we manage over 10 billion US dollar, and we have invested over 600 investment companies, over 100 IPOs, over 110 exits from the MA, trade sale, and other channels. About the Legend Capital Healthcare, with the team of 15 professionals, and since 2007, we began to investing in healthcare sector. We have invested over 150 the portfolio companies in different subsectors like the biotech, medtech, and professional services. This is a Legend Capital, the core ecosystem. We divide into the different subsectors. Some of these are in the manufacturing and supply chain in biologics, also including the CRO, CDMO companies, and CGT companies, cell therapy, gene therapy, and some innovative companies, and the medical devices company, and the IVD, and some specifies the hospital, like a cardiovascular hospital and the beauty hospital, a lot of the hospital. So LC has assembled an ecosystem along the value chain to empower the entire life cycle of the innovative medicine and medical devices development. Legend Capital has established the whole entire value chain, divided into different stage. Some is in discovery stage, clinical stage, manufacturing and supply chain, and is a commercialization stage. And we also want to provide not only about the Legend Capital, my own the portfolio companies, but we want to also open that to the other partners like the Indonesia, the partners. I think it's very, very important. And Legend Capital want to build the bridge to link the Indonesia and China. And we want to bring a lot of products, not only the products, but also the technology, talents, and their capital to Indonesia. I think by this way, we can achieve the mutual benefit for everyone. The next page, I will borrow the slogan, one of the slogan for our company, Legend Capital. In Chinese is the 志同道合的伙伴，共创心仪的事业，并分享成功。In English is collaborate with the like-minded partners to create the desired careers and share success. Thanks. Thank you, everyone.
Please give a big round of applause for Mr. Frank Hong. Thank you very much for your presentation. And ladies and gentlemen, moving on, I would now like to welcome Mr. Tai Li Chong from Sanshire Biotech to give his remarks. To Dr. Tai Li Chong, the stage is yours.
Dear honorable guests, ladies and gentlemen, it's my honor today here to share with you about China's experience and the central solution to build health community for all. Next, please. I'll talk about three agendas: China's core, central introductions, and China's experience and the central activities in some major infectious disease area. Next, please. So as we know, with the rapid progress of technology, economy, and the culture, the world is becoming one big village, especially as the pandemic and the economic exchange during the last few years showed we as humankind has to work together to prosper and have a better future. So as our President Xi Jinping proposed, we need to cooperate and build a global community of health for all and work for a healthier and a bright future for humanity. Next, please. So one of the key facts for limited disease prevention and control is for the inaccessibility of diagnostic technology and products. For 81% of the world population, the basic diagnostics plans are not available. And 47% of world population has very limited access to quick tests, which are necessary for common disease diagnosis. So innovative and accessible diagnostic products can do great help for global human health. Next, please. So since the foundation of Censure, our mission is to innovating diagnostics for all. We do our best to try to solve problems with precise and accessible all-around diagnostic solutions for customers, especially to solve accessibility problem. We do our efforts in three directions. Our product try to be simple and easy to use with a quick turnaround time, affordable, and we try to provide solutions and applications for all around solution. So as a member of MPC, I'm a strong advocate for life technology accessibility and the universal health for the world. Next, please. Central is founded in 2008 and headquartered in Changsha. We have branches in Shanghai, Beijing, United States, England, France, and also in Indonesia. We are one of the top 100 healthcare companies in China for 3 consecutive years, and we are the industry leader in molecular diagnostic, so-called precision medicine in China, and the #1 in loads of infectious disease molecular diagnostic tests. So far, we provided over 3 billion PCR tests globally. And we have clients in 160 countries and regions. Next, please. So central culture is I share, innovating diagnostics for all. We found that what the customer need is not only products. Most of, especially for new technology and new products, you need service, personalized service and enabling service. So we are dedicated to provide innovation and service for customers. Our tech support team and the medical affairs team is even bigger than our sales team. That is quite unique in the industry. Next, please. So as a total solution provider, we have subsidiaries companies close to 20, and we can make solutions for ranging from raw materials and parts to R&D reagents, and for instruments and the systems, AI systems, and also services. With this complete portfolio of subsidiaries, enable us to have really good cost control effectiveness, and also we can really provide in-depth innovation for medical problems. Next, please. So we have very broad portfolio of rapid and accurate diagnosis, almost close to 1,000 products, mostly based on open systems. Open system means it's more cost effective, it's more user friendly, it can provide customer tailored solutions. So we are setting standards for lots of disease screening and diagnostics in China and some areas in the world. Our product ranging from respiratory disease to all areas of infectious disease, blood safety, cancer screening, etc. And we provide a variety of instrument platform from semi-automatic machine to all-in-one throughput machine. And also in order to increase the accessibility of molecular diagnostics, we are one of the pioneers in mobile POCT instruments. So like our Panatic machines, third generation now provide a really relatively open system for pathogen detection. And the new QPOC system can detect up to 225 pathogens and mutations at the same time. And also we offer home test with a T-Sure system. Next, please. So this picture demonstrates how different levels of health organization can benefit from our all-around solution. From central hospital diagnosis to community care, as well as home care, we can provide personalized solutions for all levels of health organizations. Also, we can help health organization to build a public health surveillance system real time, connect to a machine so it can monitor like infectious disease epidemic, real time, chronic disease situations in a wide region. So this will enable health organization have a better grasp of all the health conditions in that region. Next, please. So we have partnership globally. We have presence in over 160 countries and participate in the detection of major infectious disease in all these regions. Especially thanks to the effort of Ms. Budi and the MOH of Indonesia, we have opened local production facility for major infectious disease control last year in Indonesia. Next, please. As a public company, we are really pay special attention to social responsibilities. So we have collaboration with all major international organizations such as WHO, UN, Red Cross, and we also donate plenty of materials and cash worldwide for health improvement. Next, please. So next, I'd like to share a little bit of experience of China disease control and prevention. So you can see from this figure, China's per capita spending on healthcare increased gradually to recently, it's already almost reached 600 US dollars. But as you know, this compared to US and the EU is really a tiny fraction. So it's almost 1/20 of the US per capita spending and less than 1/6 of EU per capita spending. But for the results and outcome, numbers says it all. The life expectancy in China has increased to 78 years old recently. That is basically pretty much similar to the US and EU systems. Even though we still have lots of room to improve, but relatively, we demonstrate a pretty efficient healthcare system. Next, please. Next. So why China can do less with more, or do more with less? The reason is partly because of effort of China's government continue to improve the infrastructure, strong drive for increase all levels of hospital infrastructure building, especially during the past 2 decades. Thanks to the booming of biotechnology and the medical industry, China has built a quite powerful multi-level prevention and control system for major disease and public health incidents. For instance, at all 5 levels, China has a pretty complete prevention system. During the last 4 years, the number of molecular diagnostic labs has increased from 3,000 to 14,000 just during a short period of 3 years. That actually greatly helped for disease early screening, diagnosis, and treatment, and help transfer the Chinese medical system from empirical medicine to precision medicine, especially over the last 3-year period of pandemic. With the help of this system, China successfully reduced deaths by millions of people. Next, please. And another key factor and strategy is that China not only built a treatment system, it paid special attention to prevention and diagnostic infrastructure building. As the WHO said, $1 you spend upfront, $8.5 you're going to save for treatment. So China has a pretty complete prevention system ranging from education, screening, and universal vaccination to diagnostics, especially for accessible diagnostics at all levels of hospitals and clinic centers, and especially is transferring from empirical diagnostic to precise diagnostic. So all these 3 factors combined, China is able to build an effective and a very efficient healthcare system. So as an active participant in the disease control and the prevention, Central not only provide a variety of molecular diagnostic tools for all levels of hospital, And we realize for new technology, new products, medical personnel, technical personnel need really strong enabling service to be able to educate them to use those technology properly. So we collaborate with China MOH. We initiated a 100,000, 10,000 program that trained over 10,000 technical personnels that enable them to use molecular diagnostics very frequently and correctly. So this program actually played a really big role for last pandemic control, and also played a big role in the push of precision medicine practice, especially in the respiratory disease. So because this program is so effective, so we started another one this year, try to for further control of infectious disease, cancer prevention in the area of hepatitis, TB, HIV, cervical cancer, etc. Also, we're collaborating with some of the top universities. For instance, we formed a joint lab with Beijing University to initiate national HPV screening, and also to form expert concerns, to form guideline, and also for basic research like identify HPV mutations, study drug resistance, and therapeutic monitoring guidelines. So as the WHO proposed, we need to eliminate viral hepatitis by 2030 and achieve HCV diagnosis rate of 90% by 2030 and a treatment rate of 80% by 2030. As you know, compared to the data in the globally currently, there's still a huge gap in the next few years to fill. And diagnostics, screening is the first step we must expedite. So China achieved quite significantly on the viral hepatitis prevention and control department. Our mortality of HPV, HCV dropped very significantly. And the HPV prevalence decreased from very high level of over 10% to now of less than 5%. There's still a long ways to go, but we really achieved a lot because the carriers such a big amount. So China has a pretty complete national policy and programs for HPV, include universal vaccination for all newborns, and include screening to stop mother-to-child transmission, and screening for high dangerous people in this category, and for screening for blood safety. Next, please. So as the #1 company in this category, Sensure has a fully automated total solution for diagnostics, therapeutics, and monitoring and screening in this HPV, HCV. You can see we have a pretty complete product cluster. Next, please. And the tests show our results is superior, has superior performance, and are ranked among the top major brands in the world. Next, please. The next I want to talk about is the cervical cancer elimination. So as WHO proposed, we need to accelerate the elimination of cervical cancer and achieve the 90, 70, 90 targets by 2030, ranging from vaccination, screening, and treatment. Next, please. So China has pursuing cervical cancer screening very actively since 2009 and achieved really significant results, especially there it's very quick to use new technologies. Since the 2015, we start to use the HPV DNA detection technology, and the detection rate increased dramatically. So from 2009 to 2020, a total of roughly about 300,000 cases of cervical cancer and the precancerous lesions were detected. And the detection rate jumped almost doubled. So as one of the major players in this field in China, we have two technology platforms to use for screening and diagnostics. One is one-tube fast-releasing technology, which can help to process really a huge amount of samples within a relatively short period of time. So one technician can handle a few thousand samples each day. And another one is the magnetic-based technology, which have really high sensitivity and is really accurate for diagnosis. So we have a 7 assay product class in this field, provide a complete option for HPV screening and diagnostics. Next, please. So we are very active participants in women's health activities, working with Chinese MOH and the hospital foundations. We started a program of accelerating the elimination of cervical cancer globally. Roadshow now it's the fourth year, and they achieved quite amazing results. And also, we are involved in developing the China cervical cancer prevention and control strategy and concepts. And the essential product was recommended. And also for remote areas, the mobile POCT HPV product was selected by Minister of Science and Technology as the HPV screening tools provided to many countries. So in such, central HPV products has been sold to more than 60 countries, include lots of European countries, Middle Eastern countries, and the East Asian countries. Next, please. So the next two categories is TB and HIV. And the WHO also set pretty aggressive goals for eliminate TB by 2030 to decrease the rate of death by 90% and decrease the incident rate by 80%. China has a pretty complete, precise prevention and control system to end TB. Since the year of 2000, the incidence of TB in China has decreased almost by 40%, and the mortality rate decreased about 70%. In the past decades, China has identified and treated over 7.6 million TB patients, successfully preventing nearly 40 million people from infection. So as one of the major brands in China, we have a relatively complete solution for TB, for drug resistance, and the TB screening. The next one is HIV. Next, please. Again, it's a very aggressive goal to achieve 95 from discovering to cure. And the next, please. In this department, actually, China has lots of room to improve because our HIV incidence has been increased over the last few years. And that's why we have put more resources into HIV assay development. And our assay is one of the two essays that passed the Uganda Ministry of Health lab test. The other one is a Roche test, and we have a performance similar to Roche. So in summary, one word, one head. There's still a long way to go, but I see really encouraging signs. We are really inspired for Indonesia MOH's dedication to transfer healthcare and benefit all Indonesian people. We will do our best to provide accessible and innovative technology and products and services for all, and investing more and more in Indonesia. Thank you.
Thank you, Dr. Tai Li Chong, for your comprehensive presentation. You may now return to your seat. Now we are going to see the next presentation, but as we wait, I would like to thank every one of you once again for coming to today's event, Indonesia-China Healthcare and Biotech Investment Forum 2024, as we are still having a long day ahead, and I hope today is going to be a fruitful day with all the discussions that we're going to have, with all the information that is going to be shared this morning. And after this, also, we are going to have a coffee break. But after the next presentation that is going to be delivered really soon, we are still waiting for the... Okay, ready. Ladies and gentlemen, now I would like to invite from the Indonesian side to give a presentation. I would like to invite Special Advisor to Minister of Maritime Affairs and Investment, Ibu Jona Widakdo Putri, to please come forward and give your presentation. Thank you.
Very good morning to everyone. My name is Jonah. I am the special advisor for the coordinating minister for maritime affairs and investment, and I'm also the vice secretary general for the high-level dialogue cooperation mechanism between Indonesia and China. 所以我估计应该大家都可以讲英文，所以我讲一下英文。如果大家有一些疑问的话，以后可以用中文跟我交流。Yang terhormat Ibu Rizka Andalusia, yang terhormat Bapak Fu Jianseng from the Embassy of China in Indonesia, our friend from the Legion capitals, and also our friend from the other ministries from Indonesia and also the Ministry of Health, and our international partner around the world. Very good afternoon almost to all of you. So actually, I just wanted to introduce a little bit about the international engagement that the Indonesian government are doing, and also some of our achievement, especially with our collaboration with the Chinese government and also our Chinese partner. Can you please put the slides, please? Okay, so usually I will actually start with an introduction of Indonesia. I ask my student, because I also teach at the university, also for international relation. I often ask my student, do you really know Indonesia? And I know maybe some of you stayed in Indonesia and maybe some visited Indonesia for the first times. But if I ask whether they know Indonesia, usually I will ask you, do you know how far to fly from the western part of Indonesia to the eastern part of Indonesia? Anyone knows? Huh? Yeah, how many hours? 10 hours? 7 hours, 10,000 kilometers, around 7 hours. Yeah, we are really big actually. So Indonesia, we fly from west to east. It's 7 hours and 30 minutes if we use quite a fast plane. Depends on the plane, so I guess. So 7 till 8 hours, and we're divided into 3 time zones. So it's a huge country with a huge population as well. Of course, we have the 17,500 island, but we also are the fourth most populous country in the world. We have the population of 282 million and a growing and green population. Because each female in Indonesia, our maternity rate is around 2.3, 2.5. So actually each family and household have 2 or 3 children. Some of my friends, I think, have 4. So it's a population. It's also a market because we are also a growing economy with a growing population of the middle-sized income in Indonesia. So if you invest in Indonesia, you not only have the market of Indonesia ourselves, which is the fourth and probably soon enough to be the third most populous country in the world, who knows, with our growing population, you also have the ASEAN country, of course. And then not only the ASEAN country, you can also have, for example, the African market. We have a very, neutral ground for our geopolitics and geoeconomic relationship in Indonesia. Hence, Indonesia is not only your market for Indonesia and for ASEAN countries, but can be your market also for the world. We have a good relationship with the 1.9 billion of the Muslim population of the world. That's also another market. And you have also Africa, which is a growing population, which will come to 2 billion person and also a growing economy. 所以我要说的是，你在印尼投资的话，你不只是有印尼的这个第4大人口的市场，有2.8亿的人口，你还有东南亚的人口，你还有非洲的快这个20亿人口的这个国家，你还有1.9亿，也就是的这个19亿的这个Muslim 人口。Because the Muslim and halal products population is also something which is big and can be your market as well. So that's a little bit about Indonesia. Next. And we have a very a strong relationship currently with China. Since I saw a lot of investors currently also come from China, we have the high-level dialogue cooperation mechanism between Indonesia and China, and between two countries or two major countries. This is a high-level dialogue cooperation is not things that they just have with all of their international partner. So meaning that the level of mutual trust, the level of mutual respect between Indonesia and China is very high. And of course, the level of mutual cooperation and mutual win-win cooperation is very high. Next. And in the highest level, which is our state leaders, we also have a very profound, level of mutual trust and mutual respect. Even last year, there's 3 times high-level meetings between the Indonesian leaders and China. President Jokowi and President Xi Jinping met in July in Chengdu, and then Prime Minister Li Qiang visited Indonesia in September. Of course, there's also the ASEAN summit, and we met again between President Joko Widodo and President Xi Jinping in Beijing in October. So in 1 year, 3 times the state leaders met together. This is also something which is not happen often in the world. Next. Of course, China have the Belt and Road Initiative. In Indonesia, actually, we have the Global Maritime Fulcrum or 全球海洋指点, 中国有一带一路. And recently, we do have a lot of synergy between the two initiatives of the Global Maritime Fulcrum and the Belt and Road Initiative. I think we work together a lot in integrity, connectivity, and also productivity. And we're seeing that connectivity in healthcare, productivity in healthcare is also something which flourishes along our relationship as well. Next. And we have some standard with our cooperation between Indonesia and China, and this is also applied, of course, with our international partner. We wanted a high environmental standard. So if you do invest in Indonesia, we strongly encourage you to please understand more about the international environment standard and the standard on environment in Indonesia. And wanted Indonesian labor utilization. We are a growing population. We're a big population. So we wanted wanted to create more Indonesian talents. And of course, we wanted our Indonesian people to also get the jobs in your investment in Indonesia. And we wanted technology transfers. And this is what we appreciate also with our cooperation with China along the way, whether it's before with Sinovac, with Sinopharm, with CanSino, with BGI, with Mindray, and the others. They do provide transfer of technology. I think this is what we call community for future destiny or 人类命运共同体有福同享有难同当 And then we wanted to integrate international best practices to be applied in your cooperation in Indonesia and also an integrated development approach. But of course, still first and foremost, environment standard is very important because I think environment and healthcare is something which you cannot separate from one another. And although a lot of our cooperation is business and business oriented, but the government actually support a lot and it's very market oriented driven, as I explained to you about the market size of Indonesia and our international partner. Next. This is just an example because this is from my previous slides. Buriska asked me suddenly to actually come to the stage. We have a very close relationship, I think, in terms of our framework of cooperation under the Global Maritime Fulcrum and the Belt and Road Initiative. Hence, we have a lot of high-level meetings and we have actually a lot of cooperation between Indonesia and China. But like throughout the years and especially last year, we actually signed a lot of G2G or government to government cooperation between Indonesia and China under the healthcare and sustainable development. I think this is something which is key and we need to actually put into implementation. And we cannot implement the G2G level cooperation without all of you here. Next. And yeah, I think Liangguo Shuangyuan is also, or two countries twin park is a strategic project between Indonesia and China, which is very much have a high level attention from President Xi Jinping. In China, they provide the Yuanhong investment zone in Fujian, and then in Indonesia, we have Bintan, Batang, and Aviarna. But it's not limited to this zone. If you can actually choose the industrial estate and the zone that you wanted to cooperate, which is suitable, for example, for your biotech industry or for your healthcare industry. Next. And this is actually a very a benchmark and a model for the high level and high tech cooperation between Indonesia and China because we succeed in operating commercially the Jakarta-Bandung high-speed railway. 亚湾高铁高科技的一个中国印尼的一个典范。So Indonesia now have the second country who have the world fastest high-speed train because it goes up to 350 kilometers per hour. Actually, when we tried, it goes up to 385, 390 without a problem and very stable. So we wanted our cooperation with China and with our international partner to be high level, to be high quality, and with high technology. And this is what we're seeing also with the trend in healthcare and biotech cooperation. I think we wanted to see more high tech and high quality healthcare investment in Indonesia, and we believe that we already seen this evidence also. Next. And Indonesia is actually, we are promoting green development, 绿色发展, 绿色经济, in Indonesia. So we're going to build the biggest green industrial park in the world in North Kalimantan. Of course, first of all, they will be electrified by the coal power plant, but later on, we will use the, the hydropower as our green resources and also solar panel, etc. So if you invest in Indonesia with our renewable energy resources, you can have green energy manufacturing green products. And this is something which is also have high value, I think, in the world. Next. And we are very committed, I think, to achieve sustainable development goals and also green transition. So we're going because Indonesia 一年四季都是没有冬天, so we have abundant solar in Indonesia. We don't have winter in Indonesia, so we have a massive solar panel, solar energy. We have geothermal, we have hydro, wind, etc. So in terms of energy transition, this is also something that we're going to move forward in Indonesia. So if you invest in Indonesia, the power that we will be using will be more and everly green. Next. Downstreaming is also a solution. That's why we don't even in also in healthcare industry. We've currently quite successful in using added value or 这个对我们的这个一些能矿的产业跟中国的合作，我们也已经看到很多的这个成功的案例，所以我们以后也希望可以在这个医疗卫生这个生物科技等等。跟中国和印尼也有一个附加值的一个产业化的一个合作。So we now can produce iron steel, carbon steel, stainless steel in Indonesia. We're going to produce lithium battery and also our own EV here in Indonesia with our abundant resources. And we, Indonesia, in terms of healthcare industry, also don't want to only be a consumer, but also we want to produce our own products for Indonesian market. And we wanted to see more downstreaming in the healthcare industry. Next. And this is just an example for our automotive industry. Next. And this is also for the EV development. So I think, we in Indonesia not only can produce the lithium battery, we can produce the tires, we can produce the aluminum, we can produce the iron steel, etc. And we wanted this industrial effect also to be having in Indonesia for the healthcare industry and biotech industry. Next. Nusantara is our next biggest project in Indonesia, and I think it's among the biggest project also in the world. Our new capital city in Kalimantan, in Kaltara. But we are also learning a lot from Shenzhen because Shenzhen have the beacon of Hong Kong. So that's why we're going to have our heartbeat of economy, which is placed at the what do you call that, North Kalimantan Industrial Estate that will support the economy for the new capital, and wanted this new capital also to be a green and smart city, and of course a city which is sustained also in terms of healthcare. That's why we invite already a lot of international hospital, and later on also for the high-tech industry to also invest in the Nusantara new capital. Next. And for example, with China, we don't only explore what we have on the land, but we also will have a cooperation, I think, in terms of the sea. I think there's a lot of things and resources in the ocean and maritime which we haven't discovered yet. And this also applies, I think, for healthcare, because currently I think we're using a lot of the raw material from our land resources. But for example, Indonesia have our seaweed, we have a lot of abundant resources at the maritime, which we can apply it in cosmetics, in medicine, biotechs, and others, which might be very useful, I think, also for future research in terms of the biotech and healthcare industry. And we're also promoting this cooperation with our international partner. China have among one of the deepest dive submarine, which can go to 11,000 meters. So next month, actually, we're going to help this cooperation with China in our Java Trench to study what can we understand more about the ocean. We're going to have also a second deep dive exploration and observation with Ocean X with our Western partner as well. So wanted to explore more about our maritime and sea resources, and how we can also apply these resources in biotech and healthcare. Next. And we're very grateful. And Indonesia, of course, not only we're going to focus more on energy security, food security, and of course, digitalization security, but healthcare security, I think it is something which is going to be a big focus in Indonesia. So this is the time window and the moment for all of you also to, come to Indonesia and explore what we can do together with win-win solution for the healthcare security, not only in Indonesia, but also the region and internationally worldwide. Next. So in conclusion, I think Indonesia and China were a comprehensive strategic partnership, which has been built for over 10 years with a principle of mutual respect, mutual trust is very important, I think, and also mutual cooperation. And I can see the level of trust also with the number of attendants which are participating here today. Next. And of course, I always say to my friend next, if you invest in Indonesia, if you grow together with our Indonesian partner next, you not only have a higher index of, business index, but also a higher happiness index. Indonesia is still considered a country which will have a high happiness index. You don't only invest in Indonesia. Next slide, dong. You can also with the picture, you can also explore Indonesia, which I say, have 17,500 islands. So you can go to these islands, and this is among of our beautiful islands and oceans. This is in Labuan Bajo, and this is the Komodo Jushi, Komodo Lung. So you can be happy also while you invest in Indonesia, because you can go to beautiful places in Indonesia and explore the wonderful thing in Indonesia. So I do hope by attending today's forum, will give you more trust in Indonesia, more respect in Indonesia, and also you can collaborate more in Indonesia. This is just a saying that I always quoted. This one of my favorite saying when I study in China. 天下事有难易乎？未之则难者，一夷夷；不为则已者，亦难矣。人之谓学有难易乎？学之则难者，一夷夷；不学则已者，亦难矣。对不对？This is saying that is there a difference between something which is difficult or easy in the world? So they said, if you go and do it, if you go study it, there's no such thing as easy and different, which is something which is easy. If you don't do anything about it, then it's nothing. But something which is difficult, if you want to do something about it, if you want to study it, it can be something which is simple and easy to do as well. So I think if you do have challenges face later on when you wanted to come or invest or cooperate in Indonesia, I'm sure that we can cope these challenges together with the spirit of wish, with this spirit of cooperation and mutual trust and respect. And I'm sure Buriska is here to support all of us. The Ministry of Health is here to support all of us. You have a good partner like Nathan here also from the Etana Biotechnology. We have our SOE as well, Biopharma. We have Calbe, etc. And I see familiar faces also like Sinovac, Sinopharm, Casino, and BGI, Mindray, and other who already invest in Indonesia. And with the Wei Xue spirit, I think nothing is difficult and nothing can actually stop us from working together and making a better healthcare quality and making a better world. So thank you very much, and wishing you a fruitful forum for today. Thank you.
Thank you very much to Special Advisor to Minister of Maritime Affairs and Investment, Ibu Dr. Jona Widakdo Putri. Terima kasih Ibu atas presentasinya. Thank you for your very clear explanation and also introduction of Indonesia. I hope it's going to be useful for all our friends who come from China today here. And also, as I have mentioned before, maybe some of you need some caffeine to stay awake, so we are going to have a coffee break for now. And after that, we will continue our agenda with panel discussion of Indonesia's and China's highlight of health sector, followed by group discussion after lunch. So, ladies and gentlemen, please enjoy your coffee break. While you enjoy your coffee break, I would like to inform you that the QR code that you see on the screen is a code that you can scan to see the attendance list, Zoom meeting materials, guidance, and also company profile. So feel free to scan to get more information. Thank you.
Hello? Yeah. Since I know that if there is a coffee break, it's very hard to call back the attendance. So please, everybody come back to the seat. We will continue for our panel. Okay, so first let me invite my guests. So 6 panelists from both China side and the Indonesia side. So sorry, I just read the company name. So Jasmine from Kimia Pharma, Park Sudiman from Biotech, and Park Susanto from KG Bio, right? Okay, yeah. And we also have the guests from the China side. We have Adam from Beijing, and Mr. Jiang from CSPC, as well as Mr. Shao from TigerMed. So please take your seat. Yeah, thank you. Yeah, take care. Sorry. Okay. So yeah, thank you. It's my very honor to host this panel, a global international panel, right? So discussion about our pharmaceutical industry as well as the vaccine business. So this is Qifei from Legend Capital. So yeah, I don't know how many times I already come to Jakarta, and I meet a lot of friends here. It's very impressive morning, and we have so many remark the presentations before. But trust me, I believe the next 2 panel will be also very interesting about the collaboration. So that's why we try to invite the guests from Indonesia plus the guests from China all together. So first of all, we have 6 panel and 6 panelists here. And so should we take like each body 1 minute to give a brief introduction of yourself plus your company? Okay, so maybe we start from here. Yeah.
Afternoon, everyone. My name is Jimmy Susanto. I'm from KG Bio. So KG Bio is a biotech company based in Indonesia. It was originally a joint venture between Kalbe and Genexin of Korea, but we got invested by General Atlantic in 2020. And we focus on biologics, novel biologics, biosimilars in manufacturing and commercialization.
Thank you. Good morning, everyone. My name is Jasmine Carsono. I'm from Kimia Pharma. We are a state-owned enterprise. And our business is pharmaceuticals, small molecules. We have generic drugs. We have an API manufacturer. We have manufacturing sites as well. And we have distribution across Indonesia, including 1,200 plus pharmacies and laboratories and clinics. So we're the largest end-to-end healthcare network in Indonesia.
Good morning, ladies and gentlemen. My name is Sudirman. I'm CEO of Biotis Pharmaceuticals Indonesia. We are new kids on the block in these industries. Founded 2020. Currently, we have 1 product we call Innovex, COVID vaccines developed by our own inactivated platforms. And then very happy to meet all of you. So I hope in these forums we can find very good partnership to grow our companies. Thank you.
Good morning, everyone. My name is Adam Roach. I'm the VP and Head of Asia Pacific for BeiGene. BeiGene is a global oncology biotech company that was founded about 14 years ago in 2010. It originated in China. It's now a multinational global organization with approvals in nearly 70 countries around the world. with 10,000 employees across 5 different continents. So looking forward to today's discussion.
Good morning. My name is Shao Hua. I'm from TechMan, and I have 17 years experience in clinical study industry. Where TechMan is a clinical research CRO, we can provide one-stop service for all kinds of medical products. And we have globally we have more than 10,000 employees, including employees in Southeast Asia region. In Indonesia, we also have a big team providing clinical research service, which today we have a fruitful discussion in this panel. Thank you.
Good morning, everyone. My name is Jackie, board director from CSPC. CSPC, we founded the company in 1938. We went to Hong Kong listed since 1994. CSPC is one of the biggest pharmaceutical company in China. Globally, we have over 28,000 employees, and our sales is about 4.5 billion USD. And thank you for Legend Capital today to having us today here, because this is my first time to come to Indonesia. We are looking for find a good partner here. Thank you.
Okay, thank you for your introduction. So today we have a theme as a collaboration. So I believe most of the guests sitting here, you have collaborators both in China or Indonesia. So I'm very interested can you share some experience about your collaboration? So maybe we start from the Indonesia companies, and could you share some successful examples? And how do you choose your partners? Give some examples, please. Yeah, anyone.
Maybe we'll start. Yeah. So KG Bio's parent company, Kalbe, actually has a long history of collaborating with Chinese companies. One of our first biosimilars, we actually licensed from Shandong Kesing. Yeah, that was a long time ago, more than 20 years ago. That was the first generation EPO. At the moment, we've already completed the tech transfer and it's already manufactured locally in Indonesia for the Indonesian market. After that, with KG Bio, we also collaborated with Shanghai Henlius. Yeah, for their PD-1. I think we just got approval in December of last year. Hopefully, we'll start commercialization this year. But yeah, there's a lot of history at Kalbe. Yeah, but there are also challenges, obviously, right? I think one of the biggest challenges was Southeast Asia and Indonesia in particular was not really looked at by the Chinese company when they want to do licensing out deals. Yeah, because I think previously, as mentioned, maybe one of the reasons was the presentation from Frank Hong before. You see 53, was it 53 licensing out deals leading up to 45? But most of them are global licensing out deals, right? In most cases, Southeast Asia and Indonesia, they're not carved out in those deals. And MNCs, when they do those deals, they don't look at our markets. So one of the biggest challenges for us in the early days, especially, is to get people to look at our territory as something interesting commercially. Yeah, that was the biggest challenge.
Good point. We will have a MNC later answer your questions. Okay. Just kidding, please.
All right. I think for us, as a state-owned enterprise, we actually have several partnerships. We have partnerships with institutions. We have partnerships with universities, of course, but we also have partnerships with mostly with private companies. Now, I think the big challenge is that I think one of the key things and the benefit for us to partner is if we want to have a diversification of our portfolio, or if we have a technology that we don't have, and to develop that technology in Indonesia or as a state-owned enterprise usually will take very long. And so with the partnership, it will ensure that we actually get access to the market faster. We have access to the technology faster, but also we have all the tech transfers and everything that we could benefit on. So, so I think although we have the challenges, I think if we have good partnerships, that will be benefit for both sides.
For Biotech, we start our company with collaboration with one university in Surabaya to develop COVID vaccines. So that's our very good experience with university and research institutions to develop the products. So another collaborations we did is with two Chinese companies. One is Survey from Anhui. We do collaboration with them to fill and finish for COVID vaccines in Indonesia. So the biggest challenge is to align our purpose with their purpose. So, like when COVID pandemic come to our countries, and we need very fast response from our partners to establish or to make a products. That's very challenges to achieve the targets, because some institution or business organization have different purpose and different targets. So the second collaboration with Chinese companies, currently we prepare for PCV13 vaccines with Minhai Beijing's biotechnologies. Very good start. We hope we have same visions to penetrate Indonesian markets. And then so far is very good understanding between two companies, because we have alliance first our vision with them. Yeah. Thank you.
Thank you, Pak Sudirman, and thank you for your explanation. My question is about the experience, but all of you mentioned about the challenges, right? So it's very interesting. We know that it's not easy to have build the collaboration. So that's why Jonah mentioned the Chinese old sayings. I think it's very impressive. So the similar questions may come to the China brands. So yeah, I know some of you already build a collaboration in Indonesia. Some are seeking for the right partners here. So why we are coming to this forum? So can you share some of the experience about the collaboration here? And if you are seeking for the right partner, what's your challenge to find the right partner? Okay, from Adam probably.
So I think there are two main challenges. One is finding a partner that is a strategic fit in terms of where the unmet need is, but also in terms of the portfolio that we have and the portfolio that a partner wants. So in a sense, a commercial strategic fit is important to find. But then secondly, I think one of the panelists earlier mentioned the word vision. Finding a company and a partner that shares your values and wants the same thing and shares your vision, I think is really, really important. And I think we talk a lot about the challenges with finding a partner, but we heard so much this morning about the immense opportunities that there are. We've got this situation at the moment where the developmental goals of many ASEAN countries align very nicely with the policy goals of the China government in terms of broadening their economic footprint throughout the region. So patience will win if we can get this right.
Thank you. Mr. Shao, what's your experience?
Well, TechMan set up entity in Indonesia in 2021. In the past 3 years, we conducted a lot of clinical trials in Indonesia. Most of them are huge sample size vaccine trial. Actually, to conduct such kind of trial is very challenging. But luckily, with the joint efforts from the local stakeholders, especially from the study site, we successfully helped several Chinese vaccines to be successfully approved in different countries, including China and Indonesia. Well, of course, to conduct clinical trial out of China, especially for Chinese companies, is very challenging. Especially in Indonesia, we will face some, long startup period, and there will be challenges for transferring samples out of Indonesia. All this will be not that good for clinical trial. And also, usually during clinical trial, we want to select site with experience, especially a specific experience for their indication. But there are not that many studies conducted in Indonesia. So for Indonesia side, they're still growing, gain the experience. So all these are challenging part, but we can also see the opportunity. Of course, there are big population here. There are a lot of naive subject. So it's a good country to conduct clinical trial to help the new therapeutic product to be approved and then benefit the people here. And the other very important partner for our CLO is the sponsors. Currently, most of our sponsors are from China. And I look forward to work more closely with a local pharmaceutical company to do clinical trial here to help your product to be approved in Indonesia and also out of Indonesia.
Oh, thank you, Dr. Shaw. So yeah, I know the TechMed is the largest clinical trial CRO company in China and already built a business here in Indonesia and want to support more international friends and local friends. So yeah, it's an advertisement. You should pay me, okay? Sorry, just kidding. Okay. So the last one is Mr. Jiang from the CSPC. CSPC is also the one of the largest pharmaceutical company in China. And I know Mr. Jiang is your first time to Jakarta, right? Yeah.
Right.
Okay. Yeah, I know you have very strong potential to find the right partner here. And what's your feeling today? Can you believe that you can find the right partner here? What's your?
I feel I gonna open my branch here tomorrow. So CSPC, we have export sales about over 1 billion USD globally, but we have zero business here. It's a kind of pity, but after today, I learned a lot from presentation. I feel this is a very big market with very big potential, and we are looking for a good partner here for long term. So for our internal decision is already made. We're gonna do investment here. We're gonna find a partner here, and I can make a joint venture here, or I can just do a CSPC Indonesia company here, both way. So I'm looking for some partner who can help us to do clinical stage study and the sales commercial side as well. Because in the world right now, we are running over 17 global clinical stage drugs mainly in the States and in Australia. But in Southeast Asia, I think Indonesia have a very good market, very good potential, especially relationship is there. And I think we can speed up our clinical stage study for some innovative drugs here. So also CSPC, 50% of our total sales is from API. We are the biggest caffeine C, vitamin C and caffeine manufacturer in the world. Also 50%, another 50% is about generics and innovative drugs, 25% for the generics. We have 16 ANDA product, which I can lower pricing for the local market, compare with either from a European company or American company or local company. We have the cost beneficial for local market here, and also for some innovative drugs. And I just sell two ADC to American company last year. One is an Nectin-4 ADC, another one is Claudin 18.2 ADC. The frame contract is about $2 billion USD. And when USA companies see our value for them, I see we also have value added to the whole chain to Indonesia as well. So any company who is looking for a good partner with us, I'm very open-minded to talk with you. Thank you.
Okay, thank you, Mr. Jiang. I believe you can find the right partner after the forum today. Okay. Yeah, okay. So we come to another question. So yeah, we have seen a very fast growth of healthcare and pharmaceutical sectors in Indonesia recently, especially when Pak Budi gave the introduction. What happened here? So the trend is very strong and promising. So my question is to Indonesia side. So what's your expectation about the future collaboration And do you believe that you will collaborate more with Chinese partners? And what kind of Chinese partners you are seeking at? I know that we have introduced a lot of Chinese company here, but of course not all of them. But I believe in the next time we will introduce more friends here. Yeah, to fit your expectation. So yeah, so Susanto.
So what kind of partners are we looking for? I think, as mentioned by Adam, I think the vision needs to match, right? The strategic vision of the companies need to match. We have a particular vision of what we think Indonesian biotech will look like. A little bit what we're hoping to achieve is what China achieved in the last 20 years, right? 20 years ago in China, biotech basically non-existent, right? Nowadays, you're licensing billion-dollar deals to US companies, multinationals. This is something that we're hoping to do. And the way we want to kickstart that is with collaborations with experienced partners through tech ventures and the such. And what we offer is the market. Yeah, I think at the moment what we're looking for is partners that are willing to grow with us. Yeah, because we're still babies basically compared to China. Yeah.
Yeah, I think for us, we're looking at where the partner has expertise where we don't. And one of them is obviously in terms of technology, where, for example, in Kimia Pharma, we have always been a generic company, and for us to innovate outside that, or to look for, let's say, new chemical entities is something very new, and it's not that we cannot do it, we just don't have the capability, and we're not used to doing that. So I think looking for a partner that can actually complement where or the capabilities that we don't have, or its technologies that we don't have, is one thing. As well as, let's say, if we want to look at outside of Indonesia, is the regulatory expertise, because we are an Indonesian company. We have always been in Indonesia. So if we want to look outside, is to look for a company that has expertise outside of Indonesia where we can collaborate.
Yeah, as a newly established vaccine company in Indonesia, our primary goal is to rapidly expand our business while ensuring the highest standards of safety, efficacies, and accessibility for our product or our future products. So we are looking for partners. We can divide it into two divides. First is from technical side, and then second is from a financial side. From technical sides, we are looking for partner who have the technologies, who can help us to accelerate it, our research and development to create the products. And then second is the technology transfer and capacity buildings to accelerate our capability to make products. And then and also for clinical trial collaborations, because some of Chinese companies see Indonesia is good market for them, and then in other sides, the Indonesian governments need resiliencies, not depend on other countries. So Indonesian governments, especially MOH, push us to increase our capability to achieve our resiliencies in order to fulfill our health securities. So another thing is supply chain partnerships, because China especially is a source of all the raw materials. So I think it's very good if we can get the partner for supply chain partnerships. And then another thing is financial supports like Legend Capital, Temasek is also we need them to support our growth in the future. Thank you.
Thank you, Pak Sudirman. And thank you for the Indonesia guest. I will make another advertisement. So thank you for the MOH plus our Indonesia industries. We have a site visiting tomorrow to the company like Carby, Kimia, as well as Biotech in the next 2 days for the Chinese delegation. So we can have more discussion in next 2 days with our partners in here, and to build more collaboration. Yeah. So my final questions will come to the China side. So yeah, there are a lot of perspectives, expectations from the Indonesia friends. So what's our answer from China side? So what's our strategy? Yeah. So Santo mentioned that some of our Chinese companies we only look at the global market, right? So not Indonesia market or emerging country. So what's the opinion for our China-based companies? So what's our strategy here, and what's the future plan? Adam, please.
Well, I think almost the inverse of what's already been discussed. So what we, for example, have expertise in is drug development, research and development, regulatory approvals, commercialization. What we don't have expertise in is Indonesia. And if you look at Indonesia, I think there are 400,000 new cases of cancer each year. And very sadly, about 270,000 Indonesians will die each year of cancer. So it's the fourth biggest population in the world and it's growing. So I think absolutely we need to find partners that share that vision and that mission to create a better society for Indonesia and who understand how to commercialize and distribute products in Indonesia, because that's the expertise that companies like mine don't necessarily have. So that's what we would be looking for in partnerships going forward.
And Mr. Shao, please.
As a clinical research CLO, our mission is to accelerate the new drug development process to benefit the patient. So in order to get the data with integrity, so as I mentioned before, the two most important stakeholders for us, one is the clinical site, and the other is sponsor. So in China, for site, we have excellent site program. In this program, we will work very closely with clinical site for to help them to build well-established systems, SOPs, in order to make them ready to conduct all kinds of clinical study. I can share with you a successful case. I remember it's 8 years ago, we helped a big hospital in China to set up the phase 1 unit with US FDA standard. And with a joint effort, several years later, we successfully passed the inspection of US FDA, and the site becomes the biggest phase 1 unit in China. So in the future, we, as I mentioned, we already work with several hospitals in Indonesia. So in the future, we will launch this program also in Indonesia to help the site to build a system in order to conduct clinical trial with high quality. Another very important strategy is for sponsor. It's called Strategical Partnership Program. And in this program, we will work very closely with our selected sponsor. We will provide, we will set up a dedicated team for the sponsor. We will have regular governance meeting. Usually our company senior management team will join this meeting to make sure that both teams will work seamlessly. In this way, we not only provide a good service to our client, but more efficient and also will reduce the cost for the clinical trial service. So I hope in the future, we not only have this kind of strategic partnership with Chinese companies, but also with our Indonesia pharmaceutical companies. Thank you.
So Mr. Jiang.
Yeah, for CSPC right now, we're gonna launch over 50 innovative drugs in next 5 years in China and in the States. But right now, I'm thinking like if we can add some clinical study here, especially for some phase 2 or 3, we just can launch the product here. So I'm looking for some partner who has this ability to handle clinical stage, also have ability to have this registration ability. So will help us a lot. But for long term, CSPC because we are very, our company has a long history. We do things, getting things done step by step. We would like to set up this partnership, like work together. We share our value. We're gonna make it a win-win situation for the partnership. So any company or partner is looking for some new modality, like for innovative drugs, we are very open to discuss again. Thank you.
Okay, thank you for all the guests here. So I want to still add one last part. So maybe each of the guests can use 1 or 2 sentences to summarize the perspective of our collaboration in the future. 1 or 2 sentences. Yeah.
It's clear that you need to collaborate for growth, right? I think that's the aim. Yeah.
Yeah. Jasmine, please.
Thank you. I think we need to continue to collaborate and look for new partnerships. And for the ones that are not working out right now, I think we should not just, in a way, throw it in the bin, because sometimes we forget, and or we think we're not going to work with them, so let them go. But I think sometimes we know in the future we might need them. So we just have to make sure we keep maintaining our relationship.
Yeah,
Thanks. Yes, please.
partnership are instrumental in driving innovations, expanding access, and addressing the unique challenges facing the industries, especially like our industries, vaccine manufacturing industries. We remain committed to fostering strategic collaborations that advance our missions, creating a healthier and more resilient world. Thank you.
Thank you. Oh, let's keep on going, Adam.
Yeah, I think the opportunities are going to rapidly increase going forward. We saw the data this morning that the China biotech sector is proliferating in terms of its expansion. I think the sector is getting better and more efficient at driving down costs in R&D. So that means that the sector can address the affordability challenges in places like Indonesia. So for me, it's a very exciting chapter ahead. The one thing I would say is that these collaborations and partnerships, I know from experience, you know from experience, are not easy. So when there are hurdles and challenges to overcome, just keep persisting, keep talking, keep working through them together, because anything worthwhile is difficult.
Yes.
And I look forward to more and more close cooperation with the stakeholders in Indonesia to help more new drug to be approved and then benefit the patient here. Thank you.
Mr. Jiang.
Yeah, for the moreover, for the product cooperation, I'm looking for some partner who can help us to set up the research to expanding our technology platform here, because we also have mRNA, which like our mRNA COVID-19 mRNA vaccine getting approval, the first one in China last year. Based on this technology, we are expanding our research based on this platform, and also we have ADC, siRNA. We have different like 8 different platforms to handle the innovative drugs. So in the future, like when the partner would like to build this kind of technology ability, we also can help you. So like refers to, there's one more thing I would like to add. For Indonesia, the biggest disease is a stroke. CSPC, we have the 3rd generation of RTPA, and this is gonna getting approval next month in China, which means we can help patient here. Yeah, thank you.
Okay. Thank you all for the guests here. Yes, I will also add 1 or 2 sentences to summarize my experience here. I first come to Indonesia 5 years ago, and in the last 5 years, we also experienced the COVID pandemic, and I'm really impressed how this country grows and how the healthcare industry grows here. And we have already talked with different Indonesia companies plus China companies, so we know the guest just mentioned about the challenge here. So we should understand for China side, we should understand the local policy. We should understand the local production policy here. And we should not just do import-export business here. We should really collaborate to find the right partner, collaboration together, and then we build the industry here. So that's, I believe, like Jonah said, it's not easy, right? There are a lot of tackles here, like the policy, the religion, the business difference. So a lot of difference here. But as our guest mentioned, if we try our best, we keep on talking, we keep on discussion with the right partners, we can build the industry here. We can help and save more lives here. Okay, thank you again for all my guests, all my friends, both from Indonesia and China. Thank you all. Yeah. We take pictures, probably.
Yes, please, ladies and gentlemen. You may rise and let's take a picture. Okay, thank you very much. Please give a big round of applause for the first discussion today. Thank you very much, Mr. Chifei, for moderating the session. And also thanks to all the panelists from both sides, from Indonesia side and also from China side. And on the first panel discussion, we have heard the potential collaboration on pharmaceutical and vaccines. Now it is time for the second panel discussion that will be focusing on medical devices and diagnostics. So I would like to invite Mr. Bonanza Taihitu, Director of Center for Global Health and Technology Policy, to moderate this session. Selamat pagi, silakan.
Thank you so very much. I think my voice is loud enough. If Chief sit over there, I will sit over here. So it's a balance. Now I would like to invite. Thank you. I would like to invite colleagues, and it has been a very interesting discussion we had in the first panel. So I hope that as much as interesting discussion will also be part in the panel too. That will focus the medical devices, and I would like to invite panelists, very able panelists, Mr. Sorry, I have to use my glasses. Mr. Ying Peng, Senior Vice President and Chief Technology Officer, Sansure Biotech Incorporated. Please. And the other panelists will be from China delegation, Mr. Zhang Man, Vice President of WEGO. Madam, sorry. Thank you, Madam. And the other one, Madam Yujiadi, Chief Investment Officer, International Finance Corporations. Very important persons that will have touch upon the questions of financing. And from Indonesia side, we would like to invite Ibu Ni Gusti Ayu, General Manager of Nikos Medical Company. And I would like also inviting Bapak Mukli Saleh, General Manager of Labio System Manufacturing. And last but not least, I'd like to invite the CEO of Cinco Prima Alloy, Mr. Agus Tinus. So this is interesting time. So we are sitting here between you and lunch. But as much as possible, we would like to make this 50 minutes conversations to be more inspiring, food for thought. So before and make you more and more hunger for partnership, then you will do more discussions during the lunchtime. So I've been informed there are questions as Chief Fei mentions also to the panelists. I will put the same questions to the all panelists. The first question is, what is your expectations on enlarging your business with regard to make partnership, collaborations from your company in China and partners in Indonesia, and vice versa, Indonesian company with partnership in China company. Please.
Okay, thank you. So my name is Peng Yin. I'm from Sunshore, as our chairman introduced earlier. We're a leader in molecular diagnostics in China. And recently, we also entered into immunoassay. As a leading diagnostic company, we're definitely looking for partners in Southeast Asia, particularly Indonesia. So I will say two things. We're looking for a partner here and globally. One is people, right? We want the people who share our vision, our culture, willingness to collaborate. And secondly, will be capability, right? Ability or quality that can help us to drive our business here locally in Indonesia. For example, you saw earlier in the signing ceremony, we just signed all the agreement. We have a local partner here that who started probably 6 months ago. Now we have our reagent, our molecular testing product made in Indonesia in a very short time. We were able to build a factory, have a product made, pass the regulatory approval. We team Ding Hai, the general manager here. We heard a lot of how hard people work, how willingness they collaborate. We're very impressed, and we're looking forward to more and more collaboration. And also not only product-wise, we're also heavily involved in the strategy and the MOH strategy to for the infectious disease prevention and control. So very excited. Thank you for all the support and collaboration. Very excited for even more in the future.
Big applause. Thank you. Thank you so very much. Mr. Ipeng, you touch upon two factors, people and capability. And if I can turn to you, Madam Zhangman, as Vice President of WEGO, again, what is your expectations on enlarging your business with regard to the partnership with Indonesian counterpart?
Thank you. Okay, I'm lucky. So thanks for having me here. I'm Vivian, representing WEGO Group International Business. So I'm the first employee in Southeast Asia based in Singapore to cover this area. So actually, WEGO has been medical device for many years, for 35 years. It's headquartered in a very small but pretty city, Weihai in Shandong province. I hope next time when Indonesia representatives come to visit China, that will be one of the stops. We'll be your greatest host. And it has become the biggest manufacturer of medical device, especially in the disposable, single-use, consumable products in China. So we cover a broad spectrum of product lines, like clinical care, like syringes, infusion sets, orthopedics, dialysis, interventional in cardiovascular and neurovascular, and a lot of different product lines you can see as like a Chinese version of Medtronic We used to have a joint venture with Medtronic 10 years ago. That's part of history. Okay, so this is the end of our advertising. So talking about the potential partnership we're looking forward to here in Indonesia, I will say the first thing is trust. Just like it has been mentioned by many guest speakers today, we come here as a stranger, so we have so many things to learn. So we really want someone who can work with us as a long-term partner. So we have this mutual trust with each other, like friends. So I would say be patient. We make friends first and then business second. Also, since Wago is already an expert in manufacturing and operation, so we are looking forward to have someone here who is really strong in commercialization. That means when we put an effort to have our human capital and investment here in Indonesia, we want to deliver the results. We want to win in the tenderings. We want to certify our products as our timeline. So this is something I think which can be supplemental to many Indonesian manufacturers. We can teach if even you have zero experience in manufacturing of medical device. We will send our engineers, scientists, factory managers, workers here to train. We can help you to send your workers to our headquarters to learn. So we can work together long term to help this country to have a stronger capability of manufacturing medical device long term, to be independent one day. That's what China have gone through in the past 30 years. We learned from J&J, Medtronic, all those multinational companies taught us how to make those products. Now it's our turn to contribute to the rest of the world. Thank you.
No, applause, big applause. Thank you so very much. And thank you for bringing the cultures of collaborations that you have in the past with your European partners, and bring it into the culture of partnership with Indonesia. And you mentioned a keyword, trust. And it's going to be long-term collaborations, and appreciate very much. Big applause to Ms. Vivian Zhang. And Madam, we have heard people, capability, and trust. And I think trust is important in terms of financing. And how do you see this goes well to the partnership that IFC can support in this kind of collaborations, please?
We're international organization, so not Chinese company or Indonesian company, and we're also not a manufacturer here. We're an investor. As you may know, that IFC is the part of the World Bank Group, and we are also the largest multilateral investor targeting private sector in emerging markets. We're also the largest investor in the healthcare sector in emerging market. So over the years, we have invested over $90 billion, over 300 companies across 70 countries. So we have the largest global healthcare network. That I think is one of the benefits we can bring to our regional clients here. So in terms of how IFC can play a role in this process. So first of all, we are a investor, so we provide our core products include equity and long-term debt financing. I think what differentiates us from most commercial banks that we tend to provide a long-term capital up to 7 to 10 years debt financing. I think the more importantly, we not just provide financing, we also provide advisory services to our clients. For example, nowadays, I think in this room, half of the participants are Chinese companies. So the reason you are here because you have a desire to move overseas, to expand in Southeast Asia, including Indonesia. As actually many of those Chinese companies, actually it's their first time to move beyond China. So for them that they feel that they probably face uncertainties, challenges, they don't know the host market very well. That's how we can help because we have our local offices in 180 our member countries and have worked there for 2 decades or 3 decades, so know the local markets fairly well. So we not only provide financing to the companies, we also provide the go-to-market strategy and also help they understand the host markets, the regulatory framework, the sector, the investment landscape, and also potential list of the partners. And also half of the participants here are Indonesian companies. Actually, there are a few of our also IFC clients. Actually, for Indonesian client, companies, they also have a strong desire to work with international players and to upgrade the production and to diversify the product offering. And so to help our Indonesian companies, we can also provide, depending on their specific sector needs, we can also provide the list of these potential collaboration partnership partners. And also some of them also want to expand in other, say, ASEAN markets or even Africa. So we also help our Indonesian clients to understand those target markets. So that's what we can contribute to. So both financing and advisory market know-how.
Thank you, Ms. Yu. Financing in terms of commercialized financing and also advisory services. And Ms. Vivian earlier mentioned that WAGO, Indonesia has been a strangers for WAGO, but we have IFC now that can connect, bring people into the a friendship or partnership with the company in China. Also, to Indonesian companies as well. IFC can be the one that bridge the partnership, and I'm happy to have more collaboration with IFC. And as part from the Minister of Health, we would like to have that partnership deepen, supported by IFC. Thank you so very much. So Ibu Gusti Ayu, again, same question. What is your expectations on enlarging your business with regard to make partnership?
Yes, please. Okay, before I answer the questions, I want to disclaimer that I am here representative my boss. So I have a lot of notes in my laptop. So yeah, we hope to improve business sustainable and innovation and product development, of course, and access to final resources. Okay.
Well, thank you very much.
Okay.
Three very powerful statement. So sustainability, Wago mentions about the long-term partnership. IFC also support that long-term partnership. Innovations, research development. Sansure has been the top 100 Chinese pharmaceutical industry and top 100 global medical devices enterprise. So the questions of innovations is not a question. It's has been proven in that sense. Also, for sustainable, of course, access to financial resources, and therefore IFC is in the middle of our conversation. So that's that's the thing. This is a good the good arrangement. So IFC in the middle to support the collaborations between the two. If I can move to Pak Muklis from Labio System Manufacturing, what is your expectations on your enlarging business and with regard to make partnership?
First of all, I like to introduce. My name is Mokhlis Saleh from PT Labio System Manufacturer. Our manufacturer produce biochemistry reagents. Until now, we have already registered 9 products, 9 parameter. I mean 9 parameters. The big problem in our manufacture our business line here is the first of all is R&D. R&D is a big issue from us because it's make it too long for the R&D. That's the first, and the second, of course, the capital finance. That's I think 2 of them is very big issue our company here.
Okay, thank you. R&D and finance, the elements that also touched upon by Ibu Gusti Ayu earlier, and good to have these conversations on this, and we'll deep dive into a more deeper conversations after the first round. But I would like to also give the opportunity of Pak Agus to respond to the question, what is your expectations, Pak Agus, on enlarging your business with regard to make partnerships?
Okay, good afternoon all. My expectation for my partnership to be a long-term partnership to enlarging the market size, and then to become first lawyer player in the industry. Then hoping the partner can transfer technology to the Indonesian industry to developing more biggest market. That's all.
Thank you, Pak Agus. So sustainability, R&D, financing, we heard that, and of course, long-term partnership. Now let's go to the second round. We deep dive into that area that colleagues or panelists highlighted in the first round of conversations, and would like to ask the same questions to all the panelists, to Mr. Ipeng. Again, from your experience and from the conversation you made earlier, what is your best practice in partnership? Could you share your success story on that, particularly in response to the Indonesian perspective of making a long-term partnership?
That's a great question. So especially I want to comment on the question both. I think Sensure is not only a company with technology, but we also can do financial collaboration as well. That's what we have been doing globally. Recently that we acquired like Quantum DX, which is a UK company. We did invested on ASAP, which is Canadian company, and also First Light, which is Boston-based US company. In China as well. So recently we acquired immunoassay company called AccuSite. So what I want to say is in Indonesia, we're not for investment only, but more from industry point of view, looking for partners that who has the ability or the things that are complementary to us, something that meet our development needs or business strategy needs, we definitely not only we can provide technical on the support or partnership, but also financially. So as for the R&D, so I'm using the UBI, the partner, local partner for production here as a successful story that in a very short time, when we build this factory, building the factory alone is not that difficult, right? It's the one that when you hire local employees to train them, right, to bring them into the ability to work, and then also the system, the quality, right, to meet not only probably Indonesia standard, but also China and MPA standard, even CE European standard. So that part is, I think, yeah, Miriam I totally agree. So China has been, that's the path China has been done. And we trying to return to the global society, right? I worked for Abbott for 18 years. That's how what Abbott's been doing, like went to a China market, work with local partner. That's what we're, as essential, we wanted to have affordable diagnostic for all, right? And that's what we've been doing in Indonesia. I think overall, the countries, Indonesia is probably we're done the most. I hope my chairman agree with me. So we not only invest to have a local partner, we train the local employees, the quality system, all the system documents, make sure, and eventually, I think that's what China company has grown, is that we will have R&D. We'll have local R&D. We'll have some of the in Indonesia for Indonesia. So let's this is for the Sunshore's molecular diagnostic products, and also maybe some of the product in the future. That's also happened to China as well, is that you have something that you really particularly needed on a top of priority of in Indonesia, but may or may not be on top of China's priority. That's something we will be really interested, either working with company like yours or our own company R&D that to develop truly in Indonesia for Indonesia. So using an example in China will be hepatitis. For Abbott, hepatitis is not on the top of the list, but for China, it was before, and now it's probably too, HCC, for example. So to summarize, I think we're not here to sell, not only to sell, commercializing, but we're also want to invest to grow with you, to train, to educate, to bring the level in Indonesia up as well. If I may have a couple of sentences to add, so this is a commercial side, but we're also work with MOH, as you know, right? You were in Shanghai. We're heavily involved in MOH strategies on the infectious disease prevention and control, working with tomorrow, Dr. Diana and I, we're going to visit a couple of universities, university lab and hospitals. The successful story we have was Beijing University Sunshore collaboration platform. We were able, you saw it earlier in one of the slides, we're working with them on the studies to translate some of the things they do research. China right now, translation medicine is key initiatives. So helping the university lab and hospital lab to translate some of the medical research into commercial labs, right? And I understand some of the university wanted to collaborate as well. So those are potentially probably your clients as well, right? So we're not only here providing products, technology, training, we're also potentially can work with your clients in a university or hospital to have a collaboration between the China University and the Indonesia University to bring the research and exchange up as well. Thank you.
No, thank you so very much. I think your boss is agree. So that is nodding. So no, it's time to share you highlight based on your experience, previous experience, and now you enlarge your partnership with UK as well, Canada and the US. So elements such enhanced ability of local product workers, enhanced quality, something that also you highlighted. And I think Miss Vivian, it's a good bridging to your to your turn. The same questions in your experience. What is your best practice in partnerships? Could you share your success story on that? And if you can deep dive into your collaborations, the previous collaboration, and how you can bring that into this long-term relations with partners in Indonesia.
Thank you. So I just mentioned that Wego and Medtronic had this joint venture in China 10 years ago. I was not part of the deal, but I think the stage in Indonesia now is very different from 10 years ago, because back to then, both Wego and Medtronic, both of them are very big players in China already. It's more a localization value segment strategy. But here, coming to Indonesia, as I said, I'm a stranger to Indonesia, and then Indonesia is a stranger to us. So in this case, I think still following your first question, picking the right partner is still my priority number one. So I don't have many best practice to share, but I think to me, there are a few principles very important to that. So first of all, make as many friends as possible. Here, we have some old friends who have continued to do business with us, but from the trading side, import, export for many years. So we may learn from them and start with them. But still, in this room, I'm truly looking forward to having more new friends after today's conference. And feel free to reach out to me, because we have big enough portfolio to partner with not just one partner here in Indonesia. So I think this is the thing I want to stress, because if you are specialized in just one department like general surgery, orthopedics, interventional, feel free to show it, because we have a full portfolio to support that. So that's the first. And secondly, I think this win-win and the mindset sharing and also mutual understanding is pretty important. So I'm ready to have some third-party consultant from legal compliance perspective to help us to get more understanding of the local law system and tax system here in Indonesia. And in the meanwhile, I think my partner should agree with me. Let's make the company very compliant and well-structured at day one. So in the end of the day, we can attract more investors, either in the private market, private placement, or public market, to bring it to longer term. So just like I mentioned, I think all of you mentioned the challenge of the capital. Yeah, but actually not a problem here. Indonesia is so hot. So not just in Southeast Asia capital, those venture funds like IFC, you can see Jadi is here. Yeah, she spent her valuable time here in this room. And also many private equity firms from Europe and the US. And also I can see some private equity fund friends like Legend Capital, and several of them, a dozen of them have come to this area. So just focus on your business and build your business really solid and attractive. Someone will come to you to bring the money to you. So don't worry about that. So that's my 2 cents.
Thank you so very much. And a big applause to the optimism that Madam Vivian bring. That financing is not a big questions, right? So because we have the good minds and good persons, players here. Then it fits to the Miss Yu turn to response. In the experience of IFC,
what is your best practice to bring partnership move forward? Of course, you have a lot of success stories in bringing that. Kindly share with us some points. Yeah. Miss Vivian earlier mentions she's a stranger to Indonesian field, and also Indonesian strangers to Miss Vivian. But with this, with make friends during these couple days of interactions. I think it is good for IFC also to share how that among these friends can be more closer and closer and become a mutual friends.
Sure. I think the first initiative is there just mentioned by Minister Budi. I think he mentioned about this 4 billion medical equipment procurement program. This 4 billion program was led by the World Bank in conjunction with the 3 other multilateral banks. So it is a massive procurement program, and it will cover not just public hospitals. It also cover labs and primary care clinics, and will cover 6,500 inhabitable islands. So it is a major initiative. And this actually, I think there are many medical equipment device companies sitting in the room. I think you must have known this program because the bidding actually will start very soon. Hopefully you're already ready to participate. And so once the companies win the bid, and then the goods, the equipment will be delivered in a staggered way over the next 4 years. So the purpose is to completely revamp the public health system, and so to let the public hospitals, clinics is well equipped. And as Minister Budi mentioned, that as public hospital raise their standards, and that will also have a positive impact on the private sector. So it will prompt the private sector also in turn to accelerate their healthcare delivery level capacity. So that's one initiative. The second initiative is directly between IFC and Indonesia MOH. So last May, the MOH and the IFC signed MOU about the health system, health reform, healthcare growth program. Yeah. So by signing the MOU, basically IFC committed to do 2 things. One is that to help domestic Indonesian pharma vaccine device companies to upgrade production, to expand the product portfolio. The second goal is to help accelerate FDI in Indonesia's healthcare sector. Because as you may know that the Indonesia currently heavily rely on imports of vaccine APIs and the most of the medical device products, and the government actually really advocated this local production policy and have this 40% local contents requirement. I think as a result, it will also accelerate or prompt the international manufacturers, including the Chinese manufacturers, to consider setting up local shops in Indonesia. So it's not just exporting products in the past. I think that probably is that's internationalization 1.0. Now it's moved to 2.0 that actually have the local production facility within the country. Yeah. That actually will directly help to improve the production or the entire, I think, ecosystem in Indonesia, in terms of the human resource training, in terms of healthcare infrastructure build up, and in terms of technology transfer. So all those things is what we aim for, and we want to accelerate, help to accelerate this process. So again, it's not just providing capital. It's more importantly, we want to provide a sector know-how to achieve this healthcare transition.
Thank you, Ms. News. So 2.0 type of collaborations now on the industrializations, and I should say with the Chinese counterpart, it's 2.0 plus. Plus in the term of, if you are using, if I can use Miss Vivian words, compliance. So that's something. Plus, if I can use Mr. Yipeng words, is quality, better quality. The standard, not only Chinese standard, but also global standard. So 2.0 plus cultures of partnership we have here. And I would like also to invite my Indonesian colleagues to also share in the experience of Nikos Medical Company, Bu Gustiayu. What is your best practice in partnership? What is your success stories on that? I know that Nikos Indo Medical products are, among others, multi-purpose ventilators, turbine driven ICU and transport ventilator, infused pump, patient monitor, and a syringe pump. So if you could share with us your success stories in bringing the partnership to move forward, please.
Okay, as a new local fabrication in Indonesia, actually, we have a big problem about the research and development. For now, we just doing assembly. But this year, Nikos Indomedical tried to research and development with product baby incubator and infant warmer. And we have a problem like technology transfer. It's so hard. We have to learn about it from very zero in Indonesia. Maybe after this agreement, Indonesia and China will more effective technology transfer.
Okay, thank you so very much. So there is a determination in moving from manufacturing productions into a more deeper R&D development. And you mentioned, Mr. Yin, that it's time to share. Also, Wago, to time to share. So you have these conversations is indeed aiming to that directions to bring the good experience from Sanshur, from Mego to the counterpart in Indonesia. And if I can move to the experience of labio system manufacturing, Pak Mukli Saleh, the labio system manufacturer produce clinical chemical reagent. And you are following the ISO standard, and as well as you are looking for not only domestic market but also beyond the domestic market. So what is, in your experience, what is your success stories in doing partnership?
Actually, our manufacturer established on 2022, starting to produce the reagent and make it a registers for our product. Until now is 9 parameters of biochemistry agents. The difficult, the hard say to that our company in the beginning is very difficult because we are the SMA, small scale manufacturer. Not many company, especially for China and Europe, to trust me to make something doing the business. That's the problem. Even the sharing the technology and finance, the both of them is very difficult for the first beginning in Indonesia. And then if some company give us the to transfer this technology, is make the how to say that make a very difficult standard. The first of all, we cannot doing the business for the high standard. That's the problem. And then many company just give up the half finished product. But in the regulation in Indonesia, cannot doing the business a half finished product. That's the point. That's why the first I told the big issue in Indonesia for especially for us, maybe all of them here for the small business is R&D is very big issue here. So
Yeah. No. Thank you so very much from bringing that into the conversations, right? Small medium enterprise start. I think all success big companies starts from small, and with good partnership. In this case, counterpart from the China, we are optimistic that many of our counterpart can develop together. You mentioned, Ms. Vivian, win-win collaborations, right? So thank you so very much, Pak Mulkis, for sharing that. And as SMEs, but you already look into the ISO standard. That's something that, of course, from the counterpart, that will be the good starting point. And to Pak Agus, if you could also share, Pak Agus, your success stories in partnership, yeah. Your manufacturing company focus on electronic equipment, appliance devices and components, yeah. And you've been more than 2 decades, 3 decades in the business. So you compared to the previous company, you have more experience. If you could share with us.
Just in the simple word, together to make all things to be more easy and more better.
I think that's summing summarize everything. Yeah. So make together we should make easier and better collaboration. So what the philosophical words coming from your extensive experience. Now we still have 10 minutes to go. I would like to invite if from the audience would like to also join the conversations. If you have things to raise or to consult with the panelists, feel free to do so. But in the meantime, I would like to invite my committee colleagues if they are from the panel, from the participants that would like to join the conversation. Please free to raise your hands, and the committee will bring the microphone to you. But before reaching to the end, I would like to ask another round to the panelists and start from Pa Agus. Pa Agus. So this is more industry specific. Yeah. In your opinion, what is the unique challenge of collaborations in biotech industry? You mentioned earlier, make it easier together, make it better. But if you can elaborate more on that, please, Bagus.
The first is about the regulation. Okay, collaboration from API, biomedic, and the medical device never ever to be done because it's not easy to combine the different file of the business. Okay. Regulation is the most things to be done.
But thank you so very much, Pa Agus, for bringing up the questions of regulations. Yeah, and as Minister Budi highlighted this morning, that the MOH commitment is to boost this providing more access, health access to all Indonesia by doing more collaborations and again flexibility in the regulations is key in that sense. So and then I turn to Pa Muklis, if you can elaborate your perspective earlier. You mentioned about the different standard, and you need to move forward as a small medium enterprise. If you can have partners that can hand in hand helping you in the developing of your company, what is the in your opinion, what is the unique challenges in these collaborations?
The unique in collaboration is maybe if any company outside to guiding me, especially for technical and finance as well, become we can create and rise our manufacturer and better than now. That's all.
Thank you very much. So technical guidance, technical capacity, and finance, two elements that you bring forward. And I turn to Ibu Gusti Ayu, the same questions. If you can elaborate more the unique challenges in collaborations at biotech industry, etc., etc.
Okay, for that questions, I think the first one is data security and privacy concerns. In collaboration involving data exchange, especially in research and development, data security and privacy concerns are a priority. And then high research and development costs, of course. Research and development costs in this industry tend to be high. Maybe collaboration in Indonesia and China will help that problem. Thank you.
Thank you so very much, Ibu Gusti Ayu, for bringing up this from your own experience, data security, privacy, and also costs in R&D. But before I turn to Ibu Yu, I'll give you the last punch. But before that, I would like to invite Miss Vivian. From the experience of yourself of Wego, you mentioned you had an experience. You have a collaboration partnership with Medtronic earlier. But what is the unique challenge in this collaboration? I know data security, privacy may be that part of the questions, but in terms of a successful partnership you had, what is the more into a more optimistic, unique collaborations in your experience?
As I mentioned, I was not part of the deal of the Waygao Medtronic joint venture, but I can say, even when we consider our joint venture or partnership here in Indonesia, I think a common goal is very important. Yeah, why do we build this entity from the very beginning? Is to earn money, is to contribute, is to accomplish our goal in like dividends, profits gain, or are we going to IPO here in Indonesia or in Singapore, in Hong Kong? Do we have those paths discussed? Do we have those common goals in mind? If we don't have those, maybe at some point in time, sooner or later, we'll reach a point we have to break up. Yeah, so this is something I think we have to set up the tone and have the initial discussion first. So with the ends to start a beginning, I think that's the wise decision to make for any partnership.
No, thank you so very much for being that straightforward on building up long-term partnership, and I hope Wego in the near future can also open offices in Jakarta or across Indonesia. You are in now in Singapore; it's very close. But when you have your persons here in Jakarta, you have the eyes and ears to support your long-term collaborations. And now I would like to turn to Mr. Ipang. Again, from your experience, what is the unique challenge in collaborations in this industry, and how you can bring that unique challenges into more optimistic for advancing partnership?
So of course, for entering into a new country with culture and the differences and IP considerations, all this has all been through in China. I think that's not for us, from our point of view, is like finding a partner who are with some ability, right? Ability, high quality, and is also difficult, right? So from your end, you said we need somebody to help us, and from our end, we say that we need somebody has certain ability. So there's a gap there, right? So, but this is not unique in Indonesia. There's similar 10, 20 years ago in China. So I guess what we all the same. I am so happy. I'm sure the rest of the China company here, that's why we're here, is we're willing to help, to grow, to train, right? So to bring our partner up along the way. So and then so talk your clinical chemistry assay, right? Did I get that right? So in China, we start as clinical chemistry, immunoassay, then the molecular testing. So the 10 years ago, the clinical chemistry market in China, the MNC, Roche, Abionol had 80% market share. Now, the probably has only 10%. So I'm sure if you're here because you probably one of the top clinical chemistry manufacturer in Indonesia. So that meaning what? Meaning your market domestic still has so big space to grow. So maybe I can, this is not a place where we can talk afterwards, is trying to, it's a step by step. First step is production assembling, you mentioned. That's what, not central though. Dr. Dai started innovation in the molecular, but clinical chemistry, immunoassay, chemiluminescence, for example, everybody, especially clinical chemistry, start assembling, right? You have a big batch bought from somebody, then you do the assemble and final production. But even for that, you try not to compliance, quality, you gotta do the ISOs, right? So in that part, grow yourself into at least somebody that we can work with on a manufacturer for now, and then gradually integrate, upgrade into R&D, right? And then the next step will be probably funding something that you have, but not in the big 100 clinical chemistry manual, immunoassay manual that we don't have, right? We'll have to translate that into our part of platform, especially we have an open system on the molecular platform for even chemiluminescent, right? If you have something that we don't, and then so this has all been the path that the China company been through. So don't get discouraged. I'm sure 5 years later, if we all still sitting here, you're gonna share your success from today and to, right? So then back to what we can do for our local partner, for example, of course, we start production as well, right? Because for that, we it's not that easy for us to find the local employee who has all the quality, has the skills to do even production. So we really, I think we did something right. Probably in a short time, we got manufactured already, but that's our first time. Meanwhile, we do the compliance and the quality ISO, right? And then the next step, like I said, will definitely that will be R&D on the way. That's what most of the Chinese company been through. So be strong, but you have to survive though. Right? Try to be a distribute maybe some of our products, right? Some of the Chinese company products, clinical chemistry. There's quite amount of Chinese clinical chemistry. I'm sure Qi and Frank, those guys can introduce to you. Try to be a distributor, right? If it's possible, and selling, making some money so you have enough to do manufacture for now, and then R&D fit with certain money to grow your R&D. And then meanwhile, once you reach certain quality, I'm sure we all looking for, we definitely with money, with technology, but you have to be, you grow some in a certain level so that we can work together.
Thank you. Thank you. A big round of applause. But before we close, I would like to invite Ms. Yu for your final remarks as the largest global development institution that focus on private sector in emerging markets. You have heard the conversations in this panel. How then you can support this kind of partnership collaborations from the perspective of IFC? You can give a short closing in this.
Yes. As I just mentioned, that IFC actually aim to attract more FDIs into Indonesia's healthcare sector. I think so we often interact with international OEMs. The common feedback from the international OEMs when it comes to investment in Indonesia healthcare, I think are three key challenges. One is the relatively lengthy licensing process. I think whether in terms of pharmaceutical or in terms of medical device, I think it takes quite long to get approval domestically. Second is the shortage of skilled labor. I think that's also briefly touched on by these two speakers. The third is the challenge of the logistics in Indonesia with its vast geography. So you have, say, you have over 10,000 islands. I just mentioned this medical equipment procurement program led by the World Bank. So it intends to cover hospitals and primary care clinics across over 6,500 islands. It's not just in terms of delivery of those medical equipment and the devices into those medical facilities. It also involves the subsequent at least 5 years of maintenance. So you can imagine the challenge to cover the vast network of facilities across over 6,000 islands. I think that's a unique challenge, I think, when operating in Indonesia. I think of the, but I think as the our this central representative mentioned that everything has a beginning. Even in China, China experienced the same development trajectory over the past 2 decades. So I think a given time, in Indonesia healthcare system will also get upgraded quickly. And I think with the close inter collaboration with the international community, I think this process will get even accelerated.
No, thank you so very much, Ms. Yu, for that closing remarks. So, colleagues, we come to the ends of our conversations. But before we close, let's bring big applause to the panelists. Mr. Ipeng, thank you so very much. Madam Vivian, thank you so very much. Ms. Yu, thank you. Ibu Gusti Ayu, terima kasih. Pak Muklis, terima kasih. Pak Agus, thank you very much. So, I would like trying to conclude, but there is a good points coming from these discussions, and I will I'm sure that this will be continuing in during lunchtime. That partnership will continue, and this provide opportunity for colleagues from China delegation, Indonesian delegations to have further conversation during lunchtime. I thank you so very much. So back to the moderator. Thank you very much for the panelists. We take a picture?
Yes, please take a picture. Ladies and gentlemen, would you please stand up and gather at the center of the stage for a photo session. Okay, thank you very much. Thank you to all the panelists from both sides, from Indonesia side and also from China side. And also thanks to Mr. Bonanza Taihitu, Director of Center for Global Health and Technology Policy, for moderating the session. It was a very interesting discussion, but we got to take a break for now because it's already 1 p.m. I'm sure each and every one of you here cannot wait to enjoy the lunch. So we're going to have a lunch break for 1 hour. So we're going to be back in this room at 2 p.m. sharp. Okay. So ladies and gentlemen, please enjoy your lunch. And the lunch is located at Satu Restaurant. So when you walk out from this room, you may turn right and go up on the elevator at the lobby level and then go down at another elevator, and you can find the Satu Restaurant there. And for the Muslim participants, I would like to inform that the prayer room or musola is on the 2nd floor. Thank you very much, and I'll see you guys after the lunch break.
And I will be your MC for the second session today, as we will have two sessions of special topic group discussion. Without further ado, for the first session, we will be focusing on pharmaceuticals and vaccine. And I would like to invite Mr. Irfat to moderate the discussion. To Mr. Irfat, the stage is yours.
Good afternoon, ladies and gentlemen. May I stand? I think this is the difficult time because we are sleepy, okay? After it. First of all, my name is Irfat Saputra. Here I representing the AB3O. What is the AB3O? The Association for Pharmaceutical, Biopharmaceutical and Raw Material, API and excipient. Okay. By the assignment from Minister of Health, we will discuss today about pharmaceutical, API, and vaccine. I saw some of them is my friend in the industry. So also some of the different industry. Anyway, to make it more quick, let's do it because in the morning we're talking about ceremonial, okay? Now we're talking about investment. Okay, the real investment. Thanks to Legend Capital, thanks to other people who came here. Yeah, let's make it happen. Yeah, because our country, my country, Indonesia, we need investment from China. Okay, we need the knowledge. We need the transfer knowledge. 1970s, we invited Europe. We invited US. We have all the big player here. I think around 20 is the international pharmaceutical manufacturing group in Indonesia. We have Pfizer, we have Bayer, we have Merck. I came from Merck. Okay, we have everyone here, Japanese. Then the next 10 years, the last 10 years, we have Korea. Yeah, the technology coming from Korea. To be honest, you're a bit late. Okay, thanks to my friend Nathan from Brazil and Etana to invite you. Now it's time for you. It's time for China to join collaboration with Indonesian company. So give applause to all of us, okay? Now we started with discussion. Yeah, later on I will accompany by the PT Kimia Pharma. Is here PT Kimia Pharma, the representative. Not yet. PT Biotis, Calbio, and then also from China side, Beijing, CSP Pharmaceutical, and Tigermed. Bu MC, Miss Feki also join. Morning menu. This one. Oh, okay. Oh, okay. Sorry. The morning menu. That's because we sleepy. Thank you. Okay, this is lunch menu. Thank you. Now we're talking about FDA Indonesia. I don't see anyway. Okay, Ibu from Badan POM yang mewakili. Bu, silakan. Let's give applause. Ibu Emma ya, Bu ya. Ibu dia. Thank you, Ibu dia. Okay. So Ibu dia representing of the biological product from from the BP POM. The name is Badan Pengawasan Obat dan Makanan of FDA Indonesia from registration. Yeah. Okay. Okay, we start with the discussion.
Good afternoon, everyone. Distinguished to all participants here, and I would like to say thanks to Ministry of Health that invited us to this event. And then in the afternoon session, I will deliver the presentation about the regulation, drug regulation in Indonesia. And on behalf of our director of drug registration, that have another agenda. So I'm here to deliver the presentation about drug regulation in Indonesia. I'm Dia Puspitasari. I'm in charge for the biological product registration, but right now the presentation is for also for chemical, generics, and even for the radiopharmaceuticals, not only for biological product. Okay, next slide. Here are the outline for today's presentation. Next. This is our office located in Percetakan Negara Street. Next. And then as agency that named Indonesian FDA, we have a vision that drug and food are safe, quality, and competitive to achieve the establishment of advanced Indonesia to be sovereign, independent, and have personality based on mutual cooperation. And right now we have 76 regional offices all around Indonesia. Next slide. And then these are the regulatory system of Indonesian FDA. Oversight for the safety, quality, and efficacy of a drug throughout the product life cycle is an integral part that cannot be separated. So data that obtained from the pre-market can be the input for the post-market and vice versa. And then for drug surveillance, it starts from the clinical trial. Indonesian FDA provide the clinical trial approval before the clinical trials are carried out, and inspection to ensure the clinical trials are carried out in accordance with the good clinical practices. And then the clinical trial data are needed to support the evidence of the safety and efficacy of drug while to ensure that the drug meet quality standard. And it's also necessary to evaluate product quality and inspect good manufacturing practices to production facilities. And then for vaccine, we have the lot release issuance of lot release for the vaccine product. And then since the drug is are susceptible and needs the special condition. So we have the good distribution practices. So the distribution of the drug should be accordance to the GDP. And then next slide. And now to keep up with the advance in information and communication technology, the Indonesian FDA also created innovation and breakthrough by digitizing food and drug control. As you see on the screen, there are several applications for online submission. For registration, we have new IRO for drug, and then e-certification for GMP and GDP, good manufacturing practice and good distribution practice. That's for the facility for distribution and also for manufacturing. And then EBPOM for export and import. And then we also have the integrated reporting for post-market control and e-reporting for pharmacovigilance. And also we have the BPOM mobile. So you can check the marketed product in Indonesia in the application. Next. And then we proudly inform you that Indonesian FDA has been assessed for WHO benchmarking. And then we have the maturity level 3 for WHO benchmarking. And right now in 2024, we propose the assessment for WLA, WHO listed authority. And in this event, I also need the support from the pharmaceutical industry to support us in the WHO listed authority assessment. Next. And then for the foundation of the drug life cycle, the product should be produced in accordance with the good manufacturing practice. And we have the guideline, Indonesian GMP guideline 2018. And then especially for the biological product, should comply to the Annex 1 and Annex 2. Next. This Indonesian FDA require GMP during development and also marketing authorization of the drug product. And the GMP should be the manufacturer should always implement to up-to-date system and technology to meet the minimum regulatory requirement. And GMP is dynamic. So we call it CGMP, current GMP. And then for basic requirement, it's a consistent manufacturing process, and then control of contamination, adequate and qualified resources, complete and traceable documentation, control and monitoring system should be in place, and then procedure for recall and handling of complaints should be in place, and audit should be conducted periodically. Next. And then GMP is not intended to place any restraint upon the development of new concept or new technologies. And then another approach is acceptable as long as it is capable of achieving the GMP principles that we want to deliver. And then for the GMP inspectorate, it's in the production control directorate. It's different directorate from my directorate. It's the GMP unit that will inspect your facilities to be in accordance with the GMP principles. Next. And then this is the new drug development. We have the regulation regarding the investigational new drug. The first is the regulation of the chairperson of Indonesian FDA, number 16/2015 regarding investigational new drug. And then for the good clinical practices, we have the regulation of the chairperson Indonesian FDA, number 21/2015. Next. And then these are the roadmap and standard for new drug development. As you may see, drug development requires a series of stages of the development and testing process in accordance with drug development standards, with the aim of ensuring that the drug to be used in the community are safe, efficacious, and quality. And then stages of drug development start with the initial development test of drug candidate, and then the preclinical test stage on animal on a laboratory scale to the clinical stage on humans on a pilot scale, and production in pharmaceutical industry facilities. And then under normal circumstances, each stage of drug development is carried out in stages, where the advanced stage can only be carried out when the process in the previous stage has been completed. However, like we've been before in emergency situation, such as during the current COVID pandemics. It is possible to modify the stages of the development process, where the stages of the process can be carried out in parallel, which is called adaptive trial design, like phase 1/2. And then in every stage of drug development, starting from the preclinical stage, the stage of obtaining a drug prototype, the stage of scaling up into a product that can be used for humans, conducting clinical trials, and the stage of producing a commercial scale, there are standards and criteria that must be met and deemed worthy to enter the next stage. And then all stages of the process must be supported by a valid test result and meet internationally accepted standards to produce safe, efficacious, and quality drug. And the initial stage of drug development, starting from the discovery stage and preclinical stage, is an important critical stage because this stage aims to determine the proof of concept of drug research. And the success at the initial stage will be the basis for further development. And then in addition, at preclinical stage, it must be able to prove that drug candidate must be safe and have the potential to produce an immune response in several species of the test animal, and including animal models that have similarities to humans, to be able to estimate the effect on humans. And standard applied at the initial development stage and preclinical trials must meet the requirement of good laboratory practices. Next. And then now we move to the marketing authorization or the registration aspect for a drug product. And then these are the regulation for drug marketing authorization. The Health Law number 17, 2023. And then the regulation of the chairperson of Indonesian FDA number 24, 2017, and its addendum, the AFO addendum regarding the regulation. And then public protection towards unexpected risk medicines by providing assurance on the quality, safety, and efficacy of medicinal product marketed in Indonesia. We will evaluate the quality aspect and also efficacy and safety aspect of the product. Next. Okay, right now there are drug registration category for new drug registration and also a variation and renewal registration. And then for registration procedure in Indonesian FDA, the first one is the pre-registration stage. It is to determine the registration category and then evaluation pathway, registration fee, and also the requirement for the document to be submitted in the registration process. And then after pre-registration stage, there is a registration stage. And then for a new drug registration, we divided into several based on the commodity. The first is new chemical entity, and then the second one is biological products, and also for generics product. And then variation registration is the post-approval changes in any aspect of drugs that, for example, like formulation changes, change of analytical method, etc. Next. Okay. This is the registration procedure in Indonesian FDA. Like I said before, that we have an online application for submit the document in new IRO. And then the registration dossier should be according to ACTD or ACTR format or ICH format. The dossier should be submitted in our application. And then after pre-registration and registration, we evaluate all the aspect of the product quality, efficacy, and safety, and also product information. And then during the evaluation process, and then there is a decision making that if the benefit is greater than the risk, and then we can together with the national committee and ad hoc clinician expert will approve the product and have a marketing authorization. Next. Here are the evaluation pathway in Indonesian FDA. There's several pathway. The first is the 7 working days for registration for export purposes, and then 10 working days for renewal registration, 40 working days for minor variation, and then 50 working days for investigational new drug application developed by a local manufacturer, and then 75 working days for first generic registration by pharmaceutical industry that invest in Indonesia, new drug and biological product variation only for quality aspect, which already approved by at least one stringent regulatory authority. And then life-saving drugs, orphan drug, drug for national program, and drug development and clinical trial in Indonesia, or any major variation, it's 100 working days. And then next is for Reliance, 120 working days. Drug that have been marketed in country that have implementing a harmonized or established evaluation system, and new registration and major variation, new indication or posology for new approved drug and biological product in at least one country with established evaluation system. We have 6 countries that we can rely on this reliance mechanism, and will be discussed in the next presentation. Next. Here are our effort to support drug promotion in Indonesia. That for imported drug registration is only prioritized for these 3. First is drugs for national health program, and then for investigational new drugs and drugs that are needed but cannot be manufactured locally. Badan POM or Indonesian FDA support the investment on providing innovative drugs in Indonesia in order to promote the availability of innovative medicine in Indonesia. And we also provide the accelerate review process of new drugs through 100 working days, as I said before, that for life-saving drugs, orphan drug in Indonesia, and then drug intended for national health programs, equipped with supporting documents for program requirement or the result of pre-qualification of WHO. And then also for investigational new drug developed by research institution or the pharmaceutical industry in Indonesia and made by pharmaceutical industry in Indonesia, and at least one clinical trial conducted in Indonesia. And then also we also support for first investigational new drug registration for pharma investment in Indonesia. That's only 50 working days. Next. Here is the reliance mechanism that I said before, that we have 6 countries that we rely on their assessment report. But the requirement is drug should be approved by at least one of this NRA. And we have USA, US FDA, and then EMA, TGA for Australia, Health Canada, and then UK, MHRA, and also PMDA Japan. And one of the requirement is applicant needs to provide full or unredacted assessment report to be included in this pathway for reliance mechanism that have 120 working days. Next. Here are the our point for evaluation for quality, safety, and efficacy aspect for drug uh, also for the biological product and vaccine. And for the quality aspect, there is drug substance evaluation, including control of raw materials, manufacturing of drug substance, characterization of drug substance, control of drug substance, and then for also for packaging and stability. And so that's for the drug product. And then for safety and efficacy, we evaluate the preclinical or non-clinical evaluation. This is for assess the safety and toxicity profile. And then for clinical evaluation for phase 1, 2, and 3. And then the clinical trial with the RCT, randomized control trial design. And then also recently we have the regulation for new drug that should submit the RMP, risk management plan, as part of our registration dossier that should be submitted to Indonesian FDA. And then for post-approval, there are a periodic safety update report. Next. This is the additional that the Secretariat said to BPOM that there is a pharma that will produce the radiopharmaceuticals. So this is the highlight for quality aspect for radiopharmaceuticals. Right now, BPOM are making the guideline for this radiopharmaceutical guideline, but still on process. But right now we can evaluate the radiopharmaceutical product as in accordance to the EMA guideline on radiopharmaceutical. Number 306,970 2007, that the highlight for quality aspect for radiopharmaceutical are purity of radionuclidic and radiochemical, and then radioactivity, radioactive concentration, pH and chemical purity, and also sterility and endotoxin for parenteral. That's for radiopharmaceuticals. Next. Okay. Here the dossier format that should be in line with ICTD or ICH also accepted. These are the part of dossier format that should be submitted to BPOM for administrative data and product information, and then quality part, non-clinical part, and also clinical part. Okay, next. Okay. The next is the validity of marketing authorization for drug in Indonesia. Typically is 5 years, but exception with some condition. The first is for license and contract manufacturing product. If the agreement less than 5 years and the validity of marketing authorization must be in accordance with the validity of letter of agreement. So if you have the agreement with the local manufacturing under 5 years, so the validity of marketing authorization is according to the letter of agreement. Okay, and then there is another exception that regarding best according to the regulation of Indonesian FDA number 23 2022 regarding the quality of product, substance, and excipients. And then for this validity of marketing authorization can be extended through renewal registration mechanism. Next slide. Okay. Here are the proofs regarding the variation registration post-approval changes. The changes may be made upon administration, efficacy, safety, quality, and product information and drug labels that categorized as notification, minor variation, or major variation. And then for the reference to chemicals, it's according to our regulation number 24 2017, and then also reference for IMA variation guideline and also ASEAN variation guideline. But only for biologics, we according with the WHO guideline, which is the TRS number 993 2015 Annex 4 for vaccine, and for biotherapeutics it in WHO TRS 1011 2018 Annex 3. Next, this for renewal registration, and the soonest submission 12 months earlier or in the latest 2 months before. And then for registration, renewal registration without changes can be submitted no later than 1 month. Next slide. BPOM or Indonesian FDA also support for self-reliance for national pharmaceutical product. Next. In this case, Indonesian FDA has established licensing simplification, import substitution policy, and also regulatory assistance for support for the pharma sector. And then this is our effort to support development of domestic pharmaceutical industry, as well as for regulatory and standard support for GLP, GMP, GCP, good submission practice, and also good review practice. And then to support the self-reliance for national pharmaceutical product, that we also support by regulatory assistance by Indonesian FDA and triple helix collaboration with the academic, business, and also a government. And then next. And then last is the conclusion that Indonesian FDA will assist every stage of development until the issuance of marketing authorization in Indonesia. And then Indonesian FDA encourage the new drug development through regulatory assistance, and marketing authorization is based on proof of quality, safety, and efficacy according to standards, and then provide guidelines and regulation involving researchers and pharmaceutical industry. And then the last is in the context of downstream of research product, collaboration between researcher, industry, and government is needed. Okay, thank you.
谢谢. I try to speak Chinese. 一点一点, okay? Okay. Give applause to Ibu Dia. Ibu Dia. Team Head Coordinator of Biological Product Registration, FDA Indonesia. We are not open the question and answer yet, correct? So please wait for your question. Yeah, I believe you have a lot of questions about how to establish pharmaceutical factory in Indonesia according to the GMP certification, and then pharmaceutical distribution certification, as well as registration of the drug. Yeah, also registration of the substance, drug substance, API or excipient. The next, I would like to invite Emma. Please come. Yeah. Emma is my counterpart from China side, from the Legend Group. Nice to meet you.
So for the next 20 minutes, so I'm Emma, I'm from Legend Capital. Good afternoon, everyone. This is probably the toughest time of today just because it's right after lunch. So we appreciate your attendance here. So for the next 20 minutes, on behalf of the representative of the Chinese company, before this meeting, we've collected a company profile. We understand that for today, one of the most important, if not the most important events or purpose of today's forum is for Chinese company and for Indonesian company to get to know each other. If you're not having enough time to talk with each other, you'll also like to keep in touch right after today's meeting, which is something that we're also looking forward to happen right after today. So for the next 20 minutes, I think I will invite the team to pull off the deck. So please share the presentation. So as you can see here, so for the first section, in the next 20 minutes, we're gonna focusing on pharma and vaccine. So pharma and vaccine, today we're happy to have these 9 companies to join today's event. So I would like to invite each of the company to stand up. In the sequence, we're gonna pass the microphone and you do share your slides with us before this meeting. So for the next 1 or 2 minutes, please introduce yourself, present a little bit, maybe give an introduction about what your company is doing, what's your focus, what you're looking for from the partnership in Indonesia. So right after today's session, they can follow up with you, then get to know each other. And just in case, if the company is not around, I will present on behalf of them based on my best knowledge. But that's how it's gonna work down. So without further ado, I would like to invite Beijing. So next slide. So if it seems like actually Beijing is not here. So the first section I will introduce on behalf of Beijing. So Beijing is, we have Adam just in the meeting, in the panel discussion this morning. So they are the leading biopharma companies originated from China. They do have a wide range of oncology portfolio in developed in China, which is a very innovative company. This is the founder and this is co-founder. John and also Wang Xiaodong. So next slide. So this is a snapshot. So Beijing is aimed for to be a global presence. And I think we're also very proud that it's a China originated, but looking for a global market. They've been have 40 offices across the 5 countries. They have 1.4 billion annual revenues, 3.5 billion cash balance. They have over 1,000 people in their oncology team, and they have more than, for example, 20 industry collaborations in the past few years. Next slide. So I think this is the last one, but I think they want to share the focus of they are paying attention and position themselves as a leading oncology companies. So if like you're interested in exploring and have the partnership conversation with Beijing, you're looking for the partnership across oncology area, I think Beijing is something that you can reach out and talk to. So right after today's section, we're gonna share the slide that you can know like who you can reach out to have further conversation. So without further ado, I'll move to the next one, which is Brilliant Pharmaceutical, Beithe. Do we have representative from? Okay, do you mind if I? Oh, no, okay, thank you. So go ahead.
Myself.
Next.
Yeah. Hello, good afternoon, ladies and gentlemen. Maybe I stop here, right? Okay. Hello, ladies and gentlemen. And my name is Tian Yonglin. From the picture, you know where I'm from. I'm from Chengdu, Japan. Yeah. Okay. Then you know. Okay. So our company founded in 2007, will be 16 years ago. So the headquarters located in the Chengdu, Sichuan province. So Beithe Berlin Pharma is a large company. I think it's top 2 in Sichuan this region. So we have over 6,000 staff, and then we have 20 plus branches, 6 R&D institutions, 8 production based into use. So currently we also have 4 production base under construction now to compliance with the FDA standards and the European standard as well. So we also want to selling our products to Indonesia, South Asia. So today for me, actually it's the second time been to Indonesia. So it's quite good impression. So now our last year marketing revenue is 10 billion RMB, about 1.4 billion US dollars. So now, so actually we are a high technology enterprise, especially, we have R&D, we have production base and sales, and then also we have generic drugs, innovation drugs, Chinese patent medicine as API as well. We have everything. So next slide, please. This is last slide, because only 1 minute, 2 minutes. So production and service. Now we have intermediate API form those, including the chemical drug, bio drug, modern Chinese medicine, and the radio pharmaceutical as well. So we got everything here. Now those we have focused on this area. Due to the time limit, I don't want to talk more. So actually, I'm here. I'm general manager of international business. For me, I'm also chairman of Hangzhou. So I'm based in Chengdu, also based in Hangzhou. I'm chairman of Berlin Pharma Biotech as well. So now, we are selling marketing. The value is 1.5 billion US dollar. We got money. We want to do investment here. So I think one way would be if we have some for Indonesia partner, you have the manufacturing, you have R&D. So we want to, we can cooperate. Actually, we want to buy some manufacturing here, R&D, whatever, something. If you have products, MA, we can share that. So another thing we can merge for the packaging as well, if you have. So yeah, now this my information, my number. I also get WeChat, my telephone number, also my WeChat, because in China with you, I used to use the WeChat. So this is my email as well. Thank you so much.
Thank you. So the next one we have casino. So next page. Do we have representative from Casino Bio? Go ahead.
Good afternoon, everybody. Selamat siang. I hope I pronounce properly. My name is Kevin, represent Casino Bio. So to make all of us memorize us more easily, I have to explain the name of the Casino. The Can means Canada, because 5 of our founders come from Canada. The immigrants to Canada, I think 30 or 40 years ago. When they come to China, they form Casino. The Sino means China. So that's why we call us Casino Bio. As you can see, we are established in 2009, and we have been listed in 2 exchange stock market in Shanghai and Hong Kong during pandemic. Our product, the COVID-19 vaccine, has been registered as EUL in WHO, and the production line has been certified by WHO as well. Currently, we have 3 manufacturer sites in Tianjin and Shanghai. And now we are carrying our vaccine in 5K platform technologies, and we already have 5 products commercialized in the market. So now the vaccines has been registered and commercialized in more than 10 countries. So for the product in the market, which the first one is Ebola. For Ebola, basically is a strategic vaccine which we prepared for African countries, which we had cooperation with the military. And another 2 is related with COVID-19. One is Covidacia muscular, Another one is very unique, is an inhaled version, which we nebulize the vaccine into the mist. Then the patient just inhale in one shot. So that's quite unique. And I have to thank you, our great partners in Indonesia, Itana, which help us to acquire the registration, which is the marketing authorization in Indonesia. And the third one, the fourth one is for meningococcal bivalent. Then the fifth one is for meningococcal with the groups ACYW 135. Okay, next page, please. And currently our pipeline will cover the combo vaccine. We start from meningococcal. Two vaccine has been in the market, which is the group A and C. The second one is ACYW 135. And together with MAM-B and the combo vaccine, which MCV4 plus MAM-B. And for pneumococcal vaccines, currently the PCV13 is conducting the clinical trial third. And also we have PBPV and the PCV24 for adults and the PCV30s. And for DTCP, which we have vaccines for kids and for adults together with TT. And the others with the shingles, TB, malaria, and also for hand-mouth foot disease, which is very suitable for ASEAN countries. So, and with the emerging disease cover COVID-19 and Ebola, and also for meningococcal. So that's the introduction for the Casino Bio. Thank you so much.
Thank you, Casino Bio. So for the next page, next one we have Liang Yihui. Do we have delegate from Liang Yihui? Please go ahead.
Thank you, everyone. My name is Jue Wang from Liang Yihui. Liang Yihui is a Chinese name. I think if the change to English is the Excellence Physician Group. Our digital health care of China. We have app and website focus on the oncologist of China. We cover nearly 200,000 oncologists of China. We have the Chinese oncologists get the more information and continue medical education and telemedicine in China. Our customer is the pharmaceutical company, including the Roche, Biotech, and almost everyone of the company of China. I think I hope we will have opportunity with the work together with the Indonesia company. Thank you.
Thank you, Liang Yihui. So the next page, we have Lingfu Shengwu, Life Bioscience. Do we have the delegate from Life Bioscience? Call for the one, call for the two, call for the three. So the delegate is not here. Let me do a quick intro then. So they are one of the Chinese CRO company that provide drug discovery and then the development for animal model. So it's more like early stage of clinical development. They are doing also animal model for metabolic diseases and also for CNS. We do have their contact information as the button. And if you're looking for the drug development earlier stage, you can consider to reach out to them to have further partnership. So for the next one, we have Reike Shengwu. So next page. So do we have delegates from Reg Bio? Go ahead, please. So can we have the mic? That's right there.
Hello, good afternoon, everyone. My name is Wilson. I'm the Senior BD Director from Reg Bio. Reg Bio is now a leading biotech company focusing on the innovative vaccines and novel adjuvants. Reg Bio was founded in 2012, and we have the experienced management team from like China CDC, MSD, Sanofi, and Sinopharm. We are listed in Hong Kong stock market, and we have 4 platforms, including the novel adjuvants. Like, you know, adjuvants is very important for the vaccines. It can increase the immunogenicity and the efficacy. So Reg Bio is also a few of the companies that can produce the novel adjuvants in the world that have been approved by FDA for the adjuvants. So we have another platform called protein engineering, and immunological evaluation, and mRNA technology. We have over 10 high-value portfolio of innovative vaccines. For our products, our main product is the non-valent HPV vaccine. We know now Indonesia have already included the 4-valent HPV in the national program, and we hope in future we can use the non-valent. Our capacity is 20 million doses every year, and now it is in the late stage of phase 3 clinical trial in China. Second is the Shingrix vaccine, and we also have finished the phase 1 clinical trial comparing with Shingrix from GSK, and we have the better result in the antibody level. Also, we have the RSV, CMV, HSV, and others in our pipeline. So in the below is my contact information, my WhatsApp, and I'm very happy to communicate with everybody. And what we are looking for is we want to look for a local partner for our non-valent HPV for the finished product as well as local production. Thank you so much.
Thank you. So for the next one, we have Sinovac. For the next page. Also the next page. So we have Kexin.
Yeah.
Do we have?
Kexin
Go
Sinovac.
ahead.
Oh, you know Chinese, right? Kexin. Well, you
Yes.
can see really. Okay, highly appreciate for the invitation of Legend Capital, right? We have been very good friends for many years. And also appreciate for the Ministry of Health, but I didn't see anyone here, right? But the Ministry of Health, the people here. Later on, we have a question for Ms. Christian, right? Your presentation is quite nice, very impressive, but I have some questions for you later on. Okay, so I'm Jonas Wang from Sinovac, and frankly speaking, I'm based in Jakarta. As a Chinese, I'm from Beijing. And on behalf of Sinovac, I'd like to give a very brief introduction about our company. But I think I no need to introduce because it seems that everyone out here, sitting here, your body circulating with our antibody, right? COVID-19 antibody, but the disaster already passed. So let's celebrate it. So for Sinovac, frankly speaking, we are a very young company. We built it in 2002, and we are in the very beginning. We started with vaccines, and but until now, we are not only focused on vaccines products. So that's why now we are a biopharmaceutical company, because so now we are also developing a lot of biological products like the rabies monoclonal and also other recombinant products and so on. So frankly speaking, for Sinovac, in the future, we will expand our business to cover all the pharmaceutical business, include the vaccine, biological, and also even medical devices maybe in the future. Next page, please. Yeah. For example, here, I just give very brief introduction about our business. Now we are already involved. The first product is the vaccine. You can see the vaccines. No, we don't only have the COVID-19 vaccine. Maybe we are famous for COVID vaccine, but frankly speaking, for Sinovac, we are the first company to pass the WHO in China for the inactivated hepatitis A vaccine. And you can see we have flu, we have SIPV, we have varicella. Varicella, another name is chickenpox, right? Everyone knows when we were young, almost every people got infected for that disease. And also, we are also developing a lot of new products. Just now, some vaccine company, they present many products in their pipeline, but for Sinovac we have, but now I didn't present it. So later on, if you have interest, I can introduce the details of our company for the new pipeline. And for therapy field, for the medicines, for example, we have now rabies. We acquired a company in Suzhou, which is the best in class in the world for the rabies treatment. I heard about that Indonesia government have a very clearly timeline for target for 2030 to eliminate the rabies. So hope for the Sinovac we also will contribute ourselves as well in the future. And also there's medical devices, nitric oxide inhalation therapy devices now is already well used in a very good hospital. For example, SCM in Indonesia, in Jakarta, they start to use. And for the third one is the technology collaboration. This is also encouraged by Capital Legend, also by the local Ministry of Health, right? So for Sinovac, we are always be open to discuss about any kind of technology collaboration. I think we are one of the first batch company to give the technology to Indonesia with biopharma for the local production for COVID-19 vaccine. And now we are trying to discuss with our local partners for more vaccine, biological, and so on for the local from fill finish and to upstream like formulation and also to the very beginning for the drug substance or to the API collaboration. So for Sinovac, we already built our established our company 2 years ago. Our office in Saboina Strategy Square. So welcome all of you to visit us and to develop the further discussion, further collaboration. Thank you. Sorry, occupy too much time. Let me hand over to next one. Yeah.
Thank you.
Thank you. Thank you.
So I think we have the last two ones on the next page. So we do have Tigerman. So I know Shao Zong give an intro. No, just would be helpful. Can you just help recap a bit on the introduction for Tigerman?
Thank you. My name is Shao Hua. I'm from Techman. I'm regional head of Southeast Asia and Latin America. Techman is a leading CRO. We originate from China. The company was established in 2004. So this year is a 20 years anniversary. We have 10,000 employees globally, and we have conducted more than 3,500 clinical trials. Now we are acting as a one-stop service CRO, providing clinical research and also preclinical study service for all kinds of medical product. In China, we're the biggest one. We from revenue, from the size, we work very closely with all kinds of companies and help to accelerate the process for clinical trial. In Southeast Asia, especially in Indonesia, we are determined to expand our business here. So we look forward to more collaboration with the stakeholders here. Well, Techman, we provide all kinds of service, including clinical operation, medical monitoring, data management, pharmacovigilance, etc. And we can also provide a central lab, a central imaging, and even site-related service. We're now working with very closely with companies like Eterna. I look forward to work more closely with other local pharmaceutical companies to develop new drug here to benefit the patient. Thank you.
Thank you. So I think that's it for the China company side. So I pass the floor back to Pak Infra, and then there will be the Indonesia company introduction. So over to you.
Okay, thank you, Emma. Again, give a big applause so that you will not sleepy. Yes, in Indonesia, actually we have more than 200 pharmaceutical companies. I believe you haven't gone to each company, right? We have a big one, we have middle, we have low. We have a chemical pharmaceutical, we have biological pharmaceutical, we have many. Yeah. So again, because this is a session different, I will try to introduce myself in Chinese language. Okay? Okay, really? Just listen, okay?
您好，我叫 Irfan，我也今天是你们的 moderator，我是代表 AB3O，而且我拥有 pharma 的公司，我的公司叫 Biotech。
谢谢。Okay. By the way, I talked to Emma this morning. It's not me. It's not me. My son. My number 2 son study now in NYU, New York University, Shanghai campus. Okay. I prepare to joining company with Chinese. Okay. I sent him 4 months. He speak Chinese already. The best way to have a girlfriend, right? Just kidding. So he talked to me this morning. Papa, this is how to introduce yourself to Chinese. Okay. Thank you if you understand very well. Okay. Now I introduce my colleague. I believe here some is my colleague. Can I ask you raise hand if one of you, which one is from Indonesia side? Raise your hand. Raise your hand, Indonesian side. Let me see, because I cannot see the difference between Chinese and Indonesian now. Okay, let me, Indonesian side. Okay, good. Still here, yeah? Because we are going to investment together with Chinese. Okay, okay. So now the first one, please. The slide, please. Okay. In this occasion, we invited some healthcare company. I believe you already know, but if not here, I will explain one by one. Brazil, still here, Brazil? No more, right? Brazil no need investment anymore. It's already from China, right? From you, right? Okay, from Legend Capital. Thank you to Legend. Yeah, so I will not explain about Brazil. It's Nathan, my best friend. Yeah, here you can explain. Yeah, no Berno Farm. Raise your hand. Ibu, you want to explain something? This is the from Berno Farm. Berno Farm located in East Java, Surabaya, the second biggest capital city in Indonesia, located of around 30 to 35 pharmaceutical industry in Indonesia. Okay, please Ibu.
Yeah, thank you and good afternoon for everyone. My name is Ria Trisna and you can call me Trisna. Here I as a representative of Bernofam company. Bernofam actually is a pharmaceutical company which is located in East Java in Sidoarjo actually. And we have started our company 1973 as a small CV drugstore actually. And we have a wide therapeutic range in our company. We develop cardiovascular product and majoring in antibiotic injection. And also we have supplement, medical actually, and wide variety of OTC product. And now we are developing and looking for partnership to expand our business in biological and vaccine, and also for biosimilar products. Thank you.
Thank you, Miss. Thank you very much, Ibu. You have a sit down, please. Yeah, again, this company is very famous in Indonesia. So those who from China, you want to join, you will go to East Java, about 1.5 hour flight from Jakarta. Okay. The next is also from East Java, Infion. Anyone from Infion? Bu? Okay, please, the lady, Ibu. By the way, before I forgot, all here is a pharmacist by education and by job. Both of them is pharmacist. So you can ask directly to them. Thank you. Please, Bu.
Good afternoon, everyone. My name Maria from Infion. Infion is an Indonesian pharmaceutical company. So there's manufacturer and a sister company from PT Beno Farm. Infion is established in Pandaan, East Java in 2008. Infion is manufactured so much many pharmaceutical lines like cardiovascular, gastrointestinal, antibiotic, hepatobiliary, and many product range. And also we are produce medical device also and the exclusive distributor from Molinke Group. Thank you so much. And we look for the partner from China in future days. Thank you.
Thank you, Ibu. Thank you very much, Ceci. So again, this is 2 already. Next slide. Okay, another from Surabaya from East Java. See, the first 3 one coming from East Java. Interbat. Anyone from Interbat? Anyone? Okay. So Interbat is one of the 10 biggest company in Indonesia, owned by local Surabaya, yeah, located in Surabaya. They have 300 products. You can see over 900 sales force, ethical, generic, brand OTC, food supplement, dental product, aesthetic product. Yeah. So this company is very strong. Very, very strong in Indonesia, especially in market of these products. So I can give you the contact or through the Minister of Health. I personally knows the people. We can do collaboration later on if they also want to go with you guys. Next, Indopharma. Anyone from Indopharma? I hope I can pay by Indopharma later on. Just kidding. Okay, Indopharma is the state-owned company. Okay, we have three state-owned company. First is Biopharma, which is vaccine. Second, in the morning, we have Ibu Jasmine from Kimia Pharma. By the name, biological pharma, biopharma. Kimia Pharma is chemical pharmaceutical. And now the last one is Indopharma. Yeah. So Indopharma is a public company, belongs to the government of Indonesia, state-owned company. So government have three. Now they become the holding. The name is the under all Biopharma. I have not many information because this is government, but you can see through the public listed company. This is a public listed. If they mention here TBK, meaning is a public listed company. You can see through the Indonesia Stock Exchange, the data, everything. Yeah. Next is Dexa Medica. Anyone here from Dexa Medica? No? Okay. We have upper Indonesian side of pharmaceutical. First, everybody knows is Kalbe Pharma. Just this morning also up around here, there is a Calbio, Calgen, and everything that's belong to Kalbe Pharma. And the next one, sometimes we call it Dexa Pharma. This is also big company in Indonesia, yeah, is producing everything, yeah. The first one developed in Palembang, which is South Sumatra, because the late Lieutenant Colonel Apotheker Dr. Andes Rudi Sutikno, he is the army who produced the medicine for the army at that time. Then he built and started the medical and healthcare industry in Indonesia, and then inspired to supply medicine in Indonesia, pharmaceutical experience to set up the company of Dexa Pharma. It's a family company. It's not public listed company. It's a family company, still owned, run by the second generation of Indonesian family. Yeah, I know personal also the gentleman over there. If you want to introduce, I can introduce to you. Next. Kimia Pharma. We have Indopharma. Now we have Kimia Pharma. The lady, Ibu Jasmine, this morning, one of the panelists. Yeah, Kimia Pharma also belongs to the government. Yeah, it was established in 1870s. Yeah, they have several business, if I'm not mistaken. Yeah, the latest one, they have the raw material pharmaceutical for API, which is the name is Kimia Pharma Sungwon. What is Sungwon? From Korea. Like I said, Korea came 5-10 years ago to Indonesia. So they produce simvastatin, atorvastatin, the things like that. They also produce now the iodine. Okay, so this is the Kimia Pharma group of company, member of Biopharma. So Indonesia holding company is Biopharma now. Consists of three: Biopharma for vaccine, Indopharma, and Kimia Pharma. Any question? So far, no. Because I'm going to my own company now. Sorry. Okay, this is my own company. PT Karya Dayasa Farmasi. I'm the owner. I'm the shareholder 100%. I started this company manufacturing of API and excipient. Why? Simply because Indonesia still imported 96% of raw materials. From where? From China, go to India, go to Indonesia, or from China to Indonesia, or from Australia, or from Germany, or from US. Okay, I used to work at that position in one of multinational company. So my company have two factory, one in Java, one in West Java, one in East Java. We are producing sodium chloride for the infusion, grade pharma for USP. We have got the license from GMP from the FDA Indonesia. Moving forward, we will produce the dextrose, DMH monohydrous. Okay. Moving forward, I'm looking for the partner in API, and excipient. So please, Capital Agent or others can contact me directly. That's enough from me. Any more question? I have no, yeah? Later, discuss with me. Next is Kombipar. I believe here, Kombipar, right? Oh, Bu Lily. Yes, Bu Lily. Please.
Hello, everybody. Combifar is established in year 1971, and we are operate in manufacturing, sales, and marketing for OTC products, ethical, and health and wellness. We do have about 8 export market as well. Our head office is in Office 8 in Senopati, and we are open and please feel free to connect with us for any opportunity and partnership. Thank you.
Thank you, Ibu Lily. Give applause, Ibu Lily. Kombipar is a family company. Like we see 1971. Yeah, it's very established company in Indonesia. Okay, so feel free to contact Ibu Lily. Feel free to contact anyone in here. I forgot to mention my other company. I also dealing with the CRO, lab, and consultant for the pharmaceutical testing, including BA, BE. Okay, thank you. Next slide. Okay, in Indonesia, basically there is 2 associations. Okay, first is we call it GP Farmasi. Yeah, National Board Indonesian Pharmaceutical Association was established in 1969. Why 69? Because this is the first time Indonesia opened to investment from foreigner to come to Indonesia. So all the industrialization of the pharmaceutical started in 1970s. Yeah, but not from China. Okay, mainly from US and from the Europe. The delegation of this company is already around 200 membership. That's including manufacturing, importing, and distribution. We call it GP Farmasi. We are also member of them. Then there is a new association, which is Association Biopharmacy and Bahan Baku Obat. We call it simply with A, B, 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 A, B, 3, and O. What is this one? Pharmaceutical raw materials. Consists of those companies who produce biopharmaceutical, such as Calbio, JBio. JBio is here? Please, you want to say something, Pak? It's okay? Calbio, JBio for vaccine, and then Biotis, Mr. Sudirman, and then Kimia Pharma Sungwon for raw material, and myself. So we have here to support government, FDA, and Minister of Health to boost, to accelerate investment of joint venture of biopharmaceutical and raw material of PI. We are welcome. We have land, we have building, we have knowledge, we have market, we know everything with the government. We can be your partner in pharmaceutical and biopharmaceutical and raw material. That's it from us. Finish, yeah? One more? No more slide, right? This is the last one. Oh, then we have the Calbio. Anyone from Calbio? I believe there is a Calgen, not Calbio. Yeah, so Calbio is belong to Calbe. Calbe Genesing Biological is one of the pioneer in biological product in Indonesia. Yeah, they also belong to Calbe Group. Yeah, I believe this morning Mr. Jimmy, Pak Jimmy, or they explained about with Calbio. Yeah, and then Biotis, Pak Sudirman in this morning, also the panelists, explain about the vaccine that they developed by themselves. This is also one of the Indonesian vaccine. So these days, since COVID 2020, we understand the importance of resiliency, how to develop by ourselves about the vaccine, biopharmaceutical, and then raw material. For the formulation drug, we don't have any issue because we have all. Yeah, here. Okay. Next. Okay. Dayong Infion. I believe there is the chairman here. There's a chairman. Chairman is not here. Dayong Infion also located in East Java. You see the name is Infion, same like the previous one. Daewon is from South Korea. So South Korea, Daewon give the transfer technology to this company to produce erythropoietin for kidney. Yeah, one of the pioneer in 2010 or 12, if I'm not mistaken, from the beginning. So we started already 10 years ago for biopharmaceutical product. Okay, the owner is also, the chairman is here. I believe he's outside, Mr. Adrianto. I will introduce to you, erythropoietin. And then the last, this is also the government company, Biopharma, everybody knows, located in Bandung, is a vaccine company. Yeah. So Biopharma, not here, the representative. Yeah. It's a state-owned company. Ibu ya Bu? Ibu, please. Maybe you can say a word, Bu, to the all so that later can ask to you. Please, Bu.
Okay. Thank you. We are from Biopharma. We are biotechnology vaccine. We are holding company. Not only vaccine, Biopharma is produce biosimilar on device medical and we have a sister company from Kimia Pharma and Indo Pharma. Thank you, Pak Irfan.
Thank you, Ibu. Thank you very much. Yeah. So this is about the Biopharma and state-owned company. Next. Etana, a sister company of Brygen. Everybody knows here, already knows. Etana is the also biological company, vaccine based on mRNA. Mr. Nathan, the famous Mr. Nathan. You can contact with him for direct information. Calventis, anyone from Calventis? Ibu, please. I believe the name is unique. Maybe you can start with what is the Calventis, Bu?
Yeah. Good afternoon, everyone. I'm from Calventis, actually the newly formed company. We are previously a Sanofi Indonesia business that has been acquired by Kalbe Pharma by the end of 2022. And now we commercializing the Sanofi portfolio in Indonesia, mainly in cardiovascular, diabetes, and vaccine. And now we are completing our portfolio. So we are looking for partnership in biologicals and also vaccine. So we are also open for more involved partnership like technology transfer and also JV. Thank you.
Thank you, Ibu. First time I met you, Ibu, also. Nice to meet you.
Nice to know you, Pak Irfan.
Yeah. So Calventis, Calbe, and Aventis. Aventis previously is Sanofi from France. Yeah, located in Jakarta. It's open. Calbe is, I believe, I know everybody this morning, there is a Pak Mulya. Yeah, everybody, they are open mind company and looking for new partnership. Thank you. Next. Calbio. Again, Calbe. Who's going to represent Calbio? Anyone? Okay, I will representative. Yeah. Calbio, one of the stem cell company in group of Kalbe Pharma. We can see here they mention about first monoclonal antibody production in Indonesia. Yeah, and then pipeline including biosimilar, novel biologies, rituximab, and everything. Just got also the certificate of GMP. So this is very, very strategic business. So anyone would like to collaborate, maybe can contact to me or to one of the, may I ask which one coming from Kalbe Pharma to stand up, please? Kalbe Pharma Group, Bu, yang dari Kalbe berdiri. Ibu. There is still two here. 3 ya, Bu? Oh ya, Bu. 3. There is 3 from Kalbe. You can ask anything to them, yeah. Because they're different, there is a medical equipment, there is a medicine, there is a biosimilar, yeah. You can ask them. JBO, Jaya Jakarta Biopharmaceutical Industry. This is also belong a member of AB3. Dr. Viriadi, you can explain to you.
Okay, good afternoon, everyone. I'm from JBio. My name is Dr. Viriandi, and we are a local biopharmaceutical manufacturing industry that we focus on vaccine, and then for TB products, for diabetes, and also for oncology. And we also have our own sister distribution company in order to make sure that our supply chain is seamless. And maybe for vaccine, we already have 2 vaccines available in the market. The first one is ZVvax, collaborating with Anhui Zhifei. And then the second one is our PCV13 vaccine, New Minvac, collaborating with Minhai Biokangtai. And we're looking forward for other, of course, other partnership to expand our portfolio in terms of vaccine, oncology product, TB solution, and of course, the diabetes product. Thank you very much.
Thank you, Pak Dr. Firyadi. So Indonesia directly investment with 2 companies from China is Etana for vaccine and JBio. Yeah, so it's not issue anymore. We know each other. We trust each other. This morning we learned about trust. We have a trusted already. Next. Okay, that's it. Complete information to all those partners from China. And also there is FDA here, Ibu Dia. Feel free to have question and answer. I'll be the moderate. As long as the question, if not satisfied you, we can do the informal discussion later. Thank you.
So I think we start the session a bit late. So before we end the section, we'd like to invite just one question. So is there any questions from the audience here about anything we just present or the question with Bipang? Go ahead.
Yeah, thank you, Miss Dia, right? Sorry. Yeah. Thank you, Miss Christina, right? Your name. Sorry, I forgot the name.
Ibu Dia is a staff of Miss Christina.
Oh, Ibu Dia,
So
Dia.
Ibu
Sorry.
Christina is the director's level.
Yeah,
Okay.
I'm sorry.
So
I'm sorry
it's
for
okay.
that. Yeah.
To give you understanding,
Yeah.
first we have the chairman. Yeah.
Chairman.
Chairman nowadays is Ibu Rita this morning.
Yeah.
Got the 2 assignment.
Yeah.
Chairman in FDA Indonesia and also the Director General. That's Ibu Rita. Okay. Sorry, Ibu Rizka. Sorry, Ibu Rizka. Okay. Below Ibu Rizka, they call it Ibu Rita Endang, Deputy 1 for medicine. Below Ibu Rita Endang is Ibu Christine. Now the staff of Ibu Christine, Ibu Dia. Dia.
Thank you, sir. Thank you, Pa. Yeah. I already heard your names for many times. You are very famous in the pharmaceutical business field. Yeah. Maybe later on we'll, yeah. Thanks for Ms. Dia. And just now your presentation is very impressive. And I have 2 small questions. The first one is regarding the new drug registration. Just now you introduced my understanding is for totally new, but I heard about that definition for Indonesia. For example, if a medicine never been registered in Indonesia, will be regarded as a new drug as well. For example, if a product is already been developed by multiple corporates, and also there's a generic from China or from India, if the generic is the first time to register it here, also be regarded as new drug. Is that true?
It is categorized as the first generic product.
Sir?
Yeah.
Yeah. First generic products will be regarded as new drug on.
But it's never been in Indonesia before.
Never been.
Oh,
Yeah.
It's a new drug.
It's a new drug, but
Yes.
not a real new. I mean that, for example, the brand products is not the generic one, but
Yeah,
the
never
generic
been in
one is the first time registered here.
Yeah.
Yeah. So will be regarded as new generic drug, right?
New drug.
New drug.
Yes.
So the registration for the real new drug and this new drug is the same or not for the registration process?
Oh, same,
Same, right?
yeah.
Okay,
Same
understand.
procedure.
Understand. The second question is just very small question is, for example, now we have a local partner in Indonesia, for example, and we do registration for one product and they are IMI holder. If, because we already finished all the registration, right, for this product, if we switch this product, the IMI holder from the current one to the new one, is the process can be brief procedure?
It's a variation registration, post-approval changes.
Totally new.
No, no. Post-approval changes, variation registration, variation.
Variation. So how long it will take maybe to switch from one to another?
For the MA holder changes,
Yeah.
it categorized as the variation, post-approval changes. So it's not considered as the new application.
Generally, how long it will last? Yeah.
It's 40 working days.
14 working days.
Yes.
40.
Yes.
Okay. Thank you. Thank you very much. Yeah.
Thank you for your question from Sinovac. So, according to the arrangement, no more question. So, if you have any question later on, maybe Emma.
No, so without further ado, I think we're wrapping up the pharmaceutical and vaccine section. So thank you everyone for your presentation and sharing, and feel free to follow up after this session. So without further ado, we're going to pass the floor back to the MC. Thank you so much.
Thank you. Thank you very much. Give applause to Ibu Dia. Thank you, Ibu Dia.
Okay, everyone.
So if you have another question, you can kindly email to our email registrasi.obat@pom.go.id. Thank you.
Okay, everyone, give a big round of applause to our panelists. Thank you very much, Mr. Irfan. Okay, now we are moving on to the second session, and we'll be talking about medical devices, focusing on equipment, devices, and diagnostics. But before we go into the next session, would you please scan the QR code in front of you, fill out the attendance list, and you will get the materials for today's event, the guidance, and the company profile of the today's participants. Or maybe you just can type the link below the QR. Okay, thank you very much. And now we are moving to the second session. I would like to invite Mr. Randi Teguh to moderate the discussion on medical devices. To Mr. Randi Teguh, the stage is yours.
Thank you, MC. Good afternoon, selamat pagi Bapak Ibu. Nah, berarti, sorry, I'm opening a bit in bahasa Indonesia ya. So, jadi peserta Indonesianya sudah sedikit kayaknya nih. Selamat pagi. Oke, bisa hitungan jari. Thank you. I'm checking in who is from Indonesia. So apparently it's still there. Okay, thank you for still here. Keep up the spirit. We are now until end of the event, but let me become the moderator of this last session. There is a topic about Indonesian, China, healthcare, biotech. Okay, that's the agenda. But the topic is about medical device, equipment, and diagnostic. There are two big events. One is the introduction about Indonesian regulatory about medical device. And then the second one is about company briefing, like the first session moderated by Pak Irfan, my good friend. But now it's on a medical device and IVD. Brief introduction to all of you from China delegate. In Indonesia, there's two regulatory body. One is BPOM or Indonesian Drug Administration. It's only regulated for drugs, food, and cosmetic. And the other one is Ministry of Health. Is the one who will regulate about medical device, household product, yeah, WFI, yeah. That's all. So there are two regulatory body. Today it's a medical device, so the regulator who will come and join me is Ibu Elva Silvi. Please join me. Please big applause. Give big applause to her.
Currently, she's a director, reviewer from Directorate of Medical Device Production and Distribution, Ministry of Health. And then after that, after her session, I would like to invite Emma, but later on, let her be still over there to be able to see what is being presented by Ibu Eva. Because of the timing, I will hand over to Ibu Eva. The time is about 15 minutes, Bu. So the stage is yours, please.
Okay, thank you, Pak Randi. Good afternoon, everyone. First of all, I want to thanks to the organizer who invite me to sit for sharing about the medical device registration in Indonesia. So I would like to thank you too for you, ladies and gentlemen, who have attended this session, which will discuss the registration of medical devices in Indonesia. So let me to start my presentation, please. Okay. This is legal basis for medical devices registration in Indonesia. We have some constitution and regulation about the medical devices. All medical devices that will be produced, distributed, and used in Indonesia must have registration number. And the registration number and our regulation is regarding about the marketing license, good manufacturing practice, good distribution practice, and also for the clinical evaluation. And then all medical devices must be evaluated regarding safety, quality, and efficacy or performance before it used. Okay, next. Indonesia has ratified the ASEAN Medical Device Directive, which means that the requirement for safety, quality, and efficacy or performance of medical devices must be met this document, as well as the classification of medical devices in Indonesia. In Indonesia, medical devices are classified into 4 classes: Class A, Class B, Class C, and Class D. It's depending of the risk of use of the medical devices. Indonesia also active in medical device harmonization association, both global or regional, like IMDRF, International Medical Device Regulatory Forum, or GHWP, Global Harmonization Working Party. And this year, Indonesia will be host for the GHWP meeting in Bali on June. Okay, next. Okay, this is a situation of medical devices in Indonesia at the end of the December 2023. We have local product license number is about 14,923 with 438 product type. And then for imported product license, we have 55,285 with 1,558 product type. And we have a local manufacturer about 842. And we have the distributors about 5,299. Most local manufacturers make medical devices by transfer technology from from overseas manufacturer. So this is challenge for us to be able to increase the number of medical devices made based on research. And we offer you the opportunity to build manufacture in Indonesia together based on research and also open the opportunity to build a raw material manufacturer that will support local production of medical devices. Because our medical devices based on transfer technology, so many company, many manufacturer made medical devices by assembly. Okay, next. Who is able to submit the medical devices? When you want to sell medical devices in Indonesia, you should have license for the manufacturer. You have license for the facility for the manufacturing, and you must meet for the certification of good manufacturing practice. And for the distributor, you have meet the requirement of certification of good distribution practice. And if you want to submit the registration application, you must appoint distributor in Indonesia. For the submitted of the application for the registration medical devices, submitted through OSS system, online single submission website, which is connected to the system at Ministry of Health, namely RegAlkes. Okay, next. Okay. For medical device product registration, both manufacturer and distributor in Indonesia can be submit. For companies from abroad, they must appoint a distributor in Indonesia. And application for medical devices product registration is carried out via OSS, okay? Like I mentioned before. And then the application will be sent to our website, RegAlkes. Okay, next. To assist manufacturers and distributors in carry out registration of medical devices, several guidelines have been published, including guideline to medical device product registration, risk class for medical devices, and also tools for determining risk classes of medical devices. So you can learn about the document and the guideline before you submit the registration application. For the guideline medical device product registration, we have in English. Okay, next. As I mentioned before, the risk classes of medical devices in Indonesia divided into four risk classes: Class A, Class B, Class C, and Class D. Where in carrying out evaluations, there are also service level agreement on different days and also cost. Apart from that, domestic local medical devices have service level agreement faster evaluation service compared to the imported medical devices. But for the cost is the same. For the example, Class A local medical devices evaluation has service level agreement in 10 days, and for the imported medical devices in 15 days. And for the Class B and C local medical devices evaluation in 20 days and imported 30 days. But for the cost is the same. For the classification, we refer to ASEAN Medical Device Directive. Okay, next. The requirement for medical devices registration consists of administrative and technical requirements, which are divided into 5 forms. Form A is administration, containing good manufacturing practice for local manufacturer or cheap CPAKB, good distribution practice for distributor or CDAKB, letter of authorization, quality management system or ISO 13485 for overseas manufacturer, CE certificate if in the labeling list the CE mark. Declaration of conformity for standard that you refer while you production your medical devices. And then brand certificate for OEM or local product and several statements regarding agency, authenticity, and integrity. And Form B contain product information, for example, description, intended purpose, indication, instruction for use, contraindication, warning, precaution, material, and production process. For Form C, contains specification and quality assurance consisting of finished product specification, preclinical or biocompatibility tests, and then clinical evaluation, risk management, design and verification validation, including serialization and software validation. And then test report from external laboratories and also factory QC. And for the medical devices emitting radiation, it must first be obtained approval for facility and products from Nuclear Energy Regulatory Agency atau Bapeten regarding the radiation use. And the Form D contains packaging including marketing, including marking both individually in the boxes and the brochure information regarding the lot or serial numbering system, manual book, and instruction for use. And for the last, Form A containing post-market evaluation, where the company must provide system and procedure related to the post-market, including complaint, adverse event, and also recall. Okay, next. For certain Class A medical devices, registration in the form of notification is also applied, where the requirements are fewer and the time is shorter. The notification applies to around 36 types of Class A medical device. Notification applied for home use, non-sterile, and not in vitro diagnostic medical devices. Like list on the right table. It's about 36 types of medical devices. Okay, next. And this is the requirement for the notification for certain A-class medical devices. For the administration, we need quality management system or ISO 13485 for overseas manufacturing, ISO 9001, CE certificate if it lists in labeling, letter of authorization, certificate of resale for imported product, and technical requirement like material, product specification, labeling, and IVU, and list of the accessories is applicable. Okay, next. Okay, that's all my presentation about medical device registration in Indonesia, and thank you for your attention.
Thank you, Ibu Eva. If I look at the topic, actually, we have to discuss about regulation, research, government support for medical device industry, potential collaboration, investment, and how to support the healthcare program for this country. So let me add something, and then probably also would like to point it out what have been explained from Ibu Eva, especially from China delegate. So actually, if you notice, Ibu Eva always mention AMDD. So AMDD actually is Asian Medical Device Directive. So once you have experienced or registered your product in other ASEAN country, actually you will not facing any problem to register it in Indonesia, right, Bu? So that's the thing. So it's also vice versa. If you have experience already introduce or submit or register your product here in Indonesia, then means you have easiest way to register your product also in other ASEAN country. So as you know, ASEAN is consists of 10 countries. But certainly in terms of maturity of regulation in medical device in this region, Indonesia is one amongst of the mature country with medical device regulation together with Singapore probably ya Bu ya. But if you go to other country like Thailand, Vietnam, probably you will facing a little bit difficulty compared to Indonesia. So yes, that's the thing that I would like to inform to you. And then one of the proof that Indonesia have a so-called maturity, good mature in terms of regulation, that everything what you have to be submit actually through online, as mentioned by Ibu Eva, actually is from OSS system. So everything online. There is no manual submission, right? Yeah, but certainly you have to learn in Bahasa Indonesia because the system is in Bahasa. The guideline already there, but the guideline is English only one, right? In English. Other thing is Bahasa Indonesia, so better you learn Bahasa Indonesia. There's two in in English, but everything others is in Bahasa Indonesia. So better you learn also Bahasa Indonesia, or else you find a good partner from Indonesian company. Now probably you can use AI or Google Translator. That's the thing. So the other thing I would like to highlight, the way you come to Indonesia, actually there is another option. One, you go directly, you bring your own product as a imported product, but be careful because we have a procurement regulation in terms of local content, which is your product considered as imported, but there is a local product already, probably your product will be freeze in the e-catalog, because now we have a e-catalog process for procurement of medical device for government hospital. That's the one. The second one, certainly you can go directly to Indonesia as a direct investment. You open your own facility as a manufacturer. That's a good one. So Indonesia can have investment coming to this country. The third one is you will be a good thing if you can collaborate or joint venture with local partner here in Indonesia. As you notice, presented by Ibu Eva, there's around 840 something Indonesian medical device manufacturing company, and also around 5,000 distributor here in Indonesia. Later on, I will introduce you to two big association here, which is ASPAKI. I noticed the chairman of ASPAKI here, Pak Himam. Can you stand up? So this is Pak Himam. Big applause to him. He is the chairman of ASPAKI. ASPAKI is an Indonesian Manufacturing Association. So the other one is from Gakeslab. I noticed Pak Irwan. He is the Vice Secretary General of Gakeslab. Later on, I will introduce to you these two associations. But before moving to that session, I would like to invite Emma to come on the stage. And now it's your turn to introduce the China delegate.
Hi, everyone. It's me again. Yay. So this is the last session of today. As same as the first section, which was focusing on pharma and vaccines. In this section, we're going to focusing on devices. So here's is the list of the company we would like to invite for their introduction. Given the time that we have until this point, I would like to humbly request our China delegate to keep the introduction within 1 or 2 minutes so we can keep the flow going, and we will have MOH colleagues to pass the microphone to your desk for presentation. So here's the list. So without further ado, I'm gonna pass to the first company. Do we have Born Denta's colleagues? Okay, go ahead. Please help pass the microphone. Thank you.
Good afternoon, everybody. Okay, and thank you. I'm the Asia Pacific and also plus India region of the Bonden Shanghai Technology. And my company is located in Shanghai. And then we built up in 2009. And then we have focused on the dental business. So who are interested in the dental sector, please come to contact with us later on. And then we have the produce, and sells the dental equipment and also consumable. And then we have around 1,000 employees, and we also have 8 factories, manufacture. And also we have a factory, which we have a brand. We also have a Bonden UDG, where actually we are produce our endophile. And then also we have the Seymour, and which we are doing the dental microscope. And also the Dr. Clear, which is for the R9ers. Normally we wear the black kits with transparent, not like a local traditional one. Also, we have a Bomedent, where doing the endo device. Maybe here you got experience in dental clinic. Every time you are very scaring with drilling, when you have carriers from your dental. So we also promote, also produce for the lost equipment device. And also we have a bone care, because we thinking education knowledge is changing, no matter between our, manufacturers, also end users are very important, even until the patient. And also we have a Bomessing, where actually we produce our dental chair. All right, so after products, let me go back. We actually yearly YOY we grow more than 30%. Also, we covered 90 countries and regions worldwide. And we got 204 patents in the world, and we got FDA, MDR, and also the NMPA license, etc. And also we have a more 500 times training course otherwise per years. We actually even involve locals, and also with the Westerners, also exchanging our knowledge, even produce our products, also involving. So later on, I will give a little bit, elaborate a little bit more. So our service is actually offering high quality dental training course and worldwide. And also we offer better after service, like I just mentioned, bone care assistance. And also we offer the dental clinic manager system to our customer, because we're thinking we also need to, not only the products, we even need to bring the value to our customers. It's a win-win situation. So we also focus on the, not even our products, also we teaching our partner or even our end user how you earn money or how you benefit from those things. Okay, so and then we actually, our aim is we looking for the further expanding in the Indonesia market, and also if not possible, we find a person, we have a local and also manufactured together with Indonesia partners. So who are interested, please contact here. We have the website, also contact person also here is Reloli. Could you raise your hand also? Can maybe in contact with him later on also for the further cooperation. And thank you for the next page. All right, give you a little bit more for our product. Thank you. Next page, thanks. So here's we provided a total solution for the endo products where actually when you go to the clinic, when your teeth are so small, so we have a start to with our microscope. And we have the best one is not even with the binocular, with those things, no more needed. We just direct with our 3D screens. So dentists can treatment our patient with your naked eyes. So this is one of our high technology on it. And we also, as I mentioned, with the dental equipment, to do your treatment for your teeth. And we also have our imaging systems. For example, our CBCT, right? When you go into the small dark room in the dental clinical 360-degree to diagnose your oral area. So we also have those CBCT and also where I mentioned, and also implants when you want to keep your oral nature teeth not much damage. And thank you so much. So can in contact with us if you need any dental products cooperation. Thanks a lot. I'm personally.
Thank you. The next one will be Guy Ray. Do we have anyone from Guy Ray? Next page. So quick intro for Garrier. They are a digital service provider focusing on the primary care. So in a country like Indonesia, the geography coverage has been quite widespread. So what Garrier has been focusing is to provide last mile services through digital. So since their establishment in 2013, they are creating or building their services across China's 31 provinces to multiple medical institutions, either through partnership directly or provide a digital or hardware service. They can provide something like all-in-one GP workstation. You can have one station to test your glucose, your hypertension, some of the basic body information. They also provide capsule clinics, telemedicine system, which can be helpful for more widespread geographic coverage. So if you're looking for any primary care collaboration, you can reach out to Guy Ray. For the next page, do we have 战略 Lipstack in the room? No? Okay. So Lipstack is a digital health company. So they are providing like digital health insurance. So they can calculate it, like what would be the potential premium, what would be the potential risk, and help you provide digital solution. I think this is something more like service end stage in terms of delivery. So if you're looking for insurance services or anything related to healthcare insurance, you can reach out to Lipstick. Next page. Next page. So do we have Jingshi? Okay, so pass the floor to Jingshi.
All right, thank you very much. Good afternoon, everyone. I am representing Jansky Medical based in Beijing, China. We are a leading provider of infectious disease gene detection services in China based on the metagenomic next generation sequencing and targeted next generation sequencing. We have developed kits for general purpose that can identify more than 26,000 infectious pathogens in one test. We have also developed kits for specific scenarios like respiratory disease, infectious pathogen detection, and also the fungal and the MTB and TB detections. So founded in 2018, we have since grown to operate 28 clinical labs, including 5 wholly owned central labs across China, with the capacity of delivering 20,000 tests per month, and with close collaboration with more than 100 leading hospitals in China. The unique advantage of Jansky's product and services is that we are providing a one-stop whole workflow and automated solutions for infectious pathogen detection. We have certified reagents, instruments, and the software that can fit for IVD and LDT applications. For further information, you can go to our website here or contact our international business contact, Ms. Pan Yu, on WhatsApp. Next page, please. So yes, this is a diagram to show our workflow tailored reagents and the instruments that we are offering. And here we are looking for collaborations of different of all kinds, either as since we have a capacity of whole workflow, we can either collaborate to deliver the whole test, or we have different, we can collaborate at different steps. Thank you for your attention. Thank you.
Thank you. So next one we have Lepu. Do we have representative from Lepu? Okay, next page.
Thanks, everyone. It's my honor here to introduce you Lepu Medical. We were founded in 1999, and we are now the leading manufacturer of cardiovascular intervention products in China. And we are proudly to rank number 58 on the 2024 MTI 100 list as one of the top 100 overall medtech companies. And we are a listed company in both China and Switzerland. We have cultivated a really good, really comprehensive medical device platform covering millions of fields, including cardiovascular intervention, CHD, neurointervention, ECG patient monitoring, dialysis, and general surgery. Please, next slide. Next slide, please. We are now currently we are dedicated to deliver our products directly to consumers, especially our healthcare products and our dental products through our official stores at Lazada and Shopee. And we are now building our stores at also TikTok and Tokopedia. And thank you for your time and attention. We have really good products and really competitive price. Feel free to contact us at any time through our website on the former slide and our email address. Thank you.
Thank you, Lepu. Next page, do we have Weitai Liao? Okay, so it's on the back.
Hello, everyone. It's my honor to make a presentation here. Just use the 3 minutes. So first of all, I just introduce my company. Just Biotech just established in 2011. So our company located in Hangzhou. It's near Shanghai, and our main product just focus on the diabetes products. Except our products like the BGM. BGM is very just like the basement of the products for the diabetes products. Now the new product like CGMS just help the patient, especially for the type 1 patient, monitoring the glucose level. And then another one like insulin pump. Insulin pump just automatically inject insulin for the patient. Actually, I just do research in Indonesia. Actually, the Medtronic sales, the price is quite high. Totally, the price is over like 5,000 USD. You just buy one piece. And the consumable just per month, you have to use the $2,000. Now our price is more cheaper, but our products are ready to sell to you in European countries so many years. Except that because this product is quite more expensive, in order to promote this product, we just develop our technology like a pen care. Pen care, this isn't just for the doctor to use to monitor the patient situation. Yeah, so actually in the future, we just like the closed loop, just like the CGMs just help the patient to test the glucose level, and the insulin pump just inject insulin automatically. So that's all. So thank you. If you feel interested in our products, just let me know. Thank you.
Thank you, Microtech. For the next page, do we have Haihe Sheng Wu on the stage? So pass the floor to Midlink.
Hello, everyone. It's an honor to introduce you Midlink Group. We are a CRO company founded in 2005. We are specializing in providing total product lifecycle services to medical device and pharmaceutical-related research institutes, R&D, and manufacturing companies. We are founding organization of Chinese Association of Medical Device Industry, third-party laboratory sub-branch, and act the secretariat. Our services mainly including 3 parts: consulting, testing, and CDMO. So if you if you're a Chinese healthcare companies, maybe we can provide services for you like consulting, helping you entering Indonesia market. And if you are Indonesia-based healthcare companies, maybe we can provide you services like consulting, help you to enter Chinese market and testing. Our testing laboratory has obtained CMA, CNAS, NAB, FDA GLP, and OECD GLP qualification. And CDMO, we can do the design and the development, design transfer, and the contract manufacturing. Thank you.
Thank you for me, Link. Next page. So next one, we'll invite Ping Shi.
Hello, everyone. My name is Li Ying. You can call me Leah. I'm from Pins Medical. Pins Medical is founded in 2008 and is an innovative medical company focusing on R&D, production, and sales of four-range neuromodulation products, including stimulator for deep brain, vagus nerve, spinal cord, and sacral nerve. So what's the meaning of PINS? The first meaning is programmable implanted neuromodulation stimulator. And the second meaning means patience is number one always. The first meaning means what we are doing. And the second meaning means what who we are doing for. And we are dedicated in neuromodulation fields. We provide cutting-edge treatment for patients who suffer from neurological disorders, such as Parkinson's, epilepsy, and chronic pain, or epilepsy. Yeah. And you can go next page. Okay. And PINS is now the first and only company in the world with full commercialized implanted neuromodulation product lines. We called it 4S. And we have more than 60 market shares in China. And if anyone interested in neuromodulation, you can contact us. And if you know any patients suffered from neurological disease, you can contact us also. Thank you.
Thank you for Pings Medical. For the next one, do we have 瑞来普医疗 Reliables?
Good afternoon, ladies and gentlemen. Thanks, Legend Capital, to provide the opportunity for me. And I'm Sean Huang from Reliable Medical. We are established in 2019, and we are only 5 years old company. And our headquarters is located in Hangzhou, Zhejiang Province, just maybe 10 kilometers away from the Westlake City. And so our employees over 180 persons. Most of them, 60% of them are the development engineering, and we are the LC, we are produce the liquid mass program and also the ICP mass. We are the maybe just the third country can produce the LC mass in the world. First is USA, and the second is Japan, and China is the third country can provide the product. And we are already provided the whole product line in China. We get the NMPA, first license NMPA for the ICP mass in China in 2021. And we already installed more than 100 sets in class 3 hospital in China. Now we will get the second license in NMPA by the end of this quarter for the LC mass. this is Indonesia is our first step to go to overseas, and our name is reliable. It means in China with is 可靠的, so it's also in English is maybe you can find a reliable partner. So we will try to find the partner in Indonesia to distribute our products, or maybe labeling or OEM. Also, it's open for all of you. And the next page, please. This is our whole product line. You can find we already have the portable GC mask. It's a very small GC mask. It's only 14 kilograms, and you can portable in your hand. And we also have gas chromatograph mask, and we also have ultra performance liquid chromatographs. And the whole product line can use in the environment, in the food science, and also in the pharmaceutical facilities. Thanks.
Thank you for reliable maths. Next page. This is for Shengxiang. Do we have delegates from Shengxiang? No? Okay. So I think this morning we all hear Dr. Dai's speech. As they mentioned, Shengxiang is one of the leading companies in the molecular diagnostic. They're famous for their IVD testing across TB, HPV, respiratory diseases, so on and so forth. They've been doing a lot of innovation in their R&D pipeline. In the past 5 years, their total revenue is around 17 billion RMB. So it's been a very sizable IVDs with a lot of leading technology. So if you're looking for expanding your in virtual diagnostic spec or reagents or anything that related to infectious disease, cancer testing, I think you can reach out to Dr. Dai's team. Next page. Next page. Do we have anyone from Lianying? Okay, I'll pass the floor to Lianying.
Hello everyone. I'm Zhao. I'm from United Imaging. Our factory in Shanghai, I think everyone should go to hospital. Maybe you do the X-ray or CT. That is right. That we are producing the CT, MR, PET, LINAC, and all the high medical equipment. So our headquarters in Shanghai that last year that our revenue may be near to 1.6 billion US dollars. So our company established in 2011. Now it is already 30 years. Our main competitor is GE, Philips, and Siemens that usually we call GPS, right? In China, we only sell less than 2 years, but in China, our market share is already number 1. So I want to tell you that our company employees already 7,000. 40% is for the R&D. And for the medical equipment, that important that the technology is very important that I just include three imports by already lead the technology. One is the total body capacity. The machine is 16 million US dollars. This machine in North America total is 2 units. What is important that you can for the conventional capacity, you need to scan 20 minutes. For this total body capacity, only 30 seconds. The dose is 1/40. The second is for MR. Usually we go to the hospital, we do the 1.5 MR, also do the 3 Tesla. Now we have a 5 Tesla. That's only in the world, the first one, 5 Tesla. For example, for some patients, if you have the brain stroke, if you have the Parkinson disease, if you with the 5 Tesla, you can fight the disease in the early stage. Also can save much more money. Also can give the patient more life. The third is for the LINAC that we have the CT guided LINAC. It's also the only one in the world. We can provide the CT and the LINAC together, and also can help people. So traditionally you need 23 days. Now only you need 23 minutes can finish the whole process. So I think in the morning very important that everyone just think the partner important for us, that especially for the big equipment, medical equipment, for the partner also is very important. We also hope for to find the perfect or best partner in Indonesia. Thank you.
Thank you, United Legend. Next page, next page. Do we have Weigao? Oh, okay. So Weigao also presented in the morning second panel. So Vivian from Singapore office has shared that Weigao is the medical device company focusing on multiple devices by collaborating with the MMC, for example, Medtronic. Since 1988, they've been developing multiple disposable single-use devices. For example, on the right-hand side, you can see they have orthopedics, dialysis solutions, surgical instruments, etc. So if your company is looking for partnership in terms of manufacturing or tech transfer related to surgical room, surgical practices, or some of the implanted hardware, feel free to reach out to Weigao. So for the next one, do we have anyone from Dongmai? Next page.
Hello, everyone. Good afternoon. My name is Kayla. It's an honor to introduce VCBIT in here. VCBIT is a top media reporting and industry research organization in China's life and health industry. And it is also one of the most influential life and health communication and exhibition service organizations in China. We founded in 2014. We have the leading financial media channels in the healthcare industry with an average annual reading volume of more than 200 million. We have secondly is we have a strong ability in conference and exhibitions planning and executions, and we have meeting the needs of the medical enterprises, government parks, and industrial institutions for brand pushing, market expansion, and resource matching. Thirdly, we have the most comprehensive database of innovative enterprises in the life and health industry in China. We have the more than nearly the 180,000 innovative enterprises. Our service is firstly is conference and exhibition services for the life and health industry. The secondly is our media content production and brand communication services. We are the China's largest source of original content for the medical and health industry. Thirdly is research and consulting services. We have on the trust of government agencies, investment institutions, and medical companies in China and all over the world. Lastly is we have abundant industrial resources and provide services that promote resource corporations. China's largest high-end network in the medical and health industry. Please, the next page. This is our two project of our this year. The first is 2024 BBEF Future Healthcare Ecological Fair. The fair will be held from May 8th to May 10th. It is upgraded from the Future Healthcare Baby 100 conference. We have successfully held 7 future medical top 100 conferences with nearly more than 10,000 industry practitioners. It is currently the largest and most information-rich industry in China healthcare innovation industry. The fair will display more than 100 Chinese products and for international cooperation. We are very welcome international partners and our Indonesia partners to visit and share your country's market needs and to find your favorite products in China, Beijing. The secondly is BBEF Indonesia Medical Diagnosis and Home Medical Equipment Expo. We will held this exhibition in Indonesia, Jakarta, and we will bring China's excellent products to Jakarta. And we'll set up forums and exchange meetings, aiming to help Chinese and Indonesian enterprise in patient and rapid trade cooperation, investment and mergers and acquisitions, and local expansion. And we are looking for Indonesian partners who could help Chinese company to expand in Indonesia, Asia, or invest or landing in. And we also welcome Indonesia friends go to China, and we will help you to expand the China market. Okay, thank you.
Thank you, VCP. So there will be events hosting in China and also Jakarta in the next few months. So please keep it posted. Last but not least, next page, we have Purui Chenzhen. We have delegate from Purui Chenzhen. Okay, please go ahead.
Hello, my name is Aaron. Yes, Pure Global is established in US in 2020. Our founder, Felix Mong and DJ's AIGC sponsor, they developed the medical device data GRIP. Also, they built the AIG's regulation document through IFU AI. And our company has three servers. First is GMA, second is clinical research, and last, we have own software and data solution, such as product certificate management, market insight, regulation, intelligence, and distributor data. And also, if you have some interesting sell the product to global, welcome to find me. Thank you.
Thank you so much. I think that's it for China side. So without further ado, I'll pass the floor back to the moderator for the Indonesia side. Thank you.
Yeah, thank you, Emma. Now it's time for Indonesia. I believe there is 15 presentation come from Indonesian side. The slide, please, being prepared. Shown. Yes, okay. The first one will be PT Nikos Indo Medical. The representative is here. Dari PT Nikos Indo Medical. Oke, sudah tidak ada. Let me read it out. PT Nikos Indo Medical is a company that focus on manufacturing and distributing healthcare equipment, established in 2017. They are focused on electromedical, like ventilator, turbine-driven ICU and transport ventilator, infusion pump, patient monitor, and syringe pump. So I believe PT Nikos is member of ASPAKI and Gakaslab. Later on, if you would like to contact to them, you can contact to the association. So next to the second one, PT Surikon Gemilang Karya. The representative is here. Already left. Okay, then I will read out. PT Surikon is a private company located in Surabaya, East Java as well. Like explained before by Pak Irfat, Surabaya is the second biggest city of Indonesia. Has the main business specializing in medical gas installation, nurse call, MOT hospital, clinics, engage in marketing and distribution of medical device through an e-catalog and medical device. As I explained earlier, if you would like to participate in government procurement, we have a system called it e-catalog. And for your information, 70 and 80% of market of medical device actually is a government funding. So nothing else, you better go to e-catalog. So you can contact PT Surikon Gemilang Karya if you would like to also engage them in terms of gas medic installation or even nurse call, MOT hospital, etc. So the third one is PT Labio System Manufacturer. Okay, not here anymore. Was founded in 2022 and has been operating its activities under the name of Labio System Manufacturer. They focus on lab and IVD. They are in West Java. It's around 80 kilometers or 100 kilometers from Jakarta city. Yeah, they focus on clinical chemical reagent according to ISO standard and directive of medical Indonesian MOH. Yes, so if you would like to have a partner for IVD reagent lab, you can contact to Labio System Manufacturer. The next slide is PT Sinko Prima Alloy. I believe Pak Agus or Ibu Nani is still here. Yes, please explain about your company.
Okay, good afternoon, everybody. My name is Nani. I'm from PT Sinko Prima Alloy. Our company is manufacturer company of electronic equipment, appliance, device, and component, which was founded 1995. Our location is in Surabaya, and They produce electromedical and equipment under the Biotech brand, having a qualifier for ISO 9001 to 25, ISO 30485, 2016, and we good manufacture practice for medical device, etc. Thank you.
Thank you, Ibu Nani. Please give applause. So next one is PT UBC, PT UBC atau UBC Medical Indonesia. The representative is here. Okay. UBC Medical is a company based in Indonesia. As you know, we have a 208, almost 280 million population. They call it as a market world-class product for detection of infection disease and genetic disorder in newborns in Indonesia. They apply a specific combination of expertise in medical equipment, pharmaceutical, and biotechnology to deliver products that aim to provide healthcare solutions that can save and improve patient life. Their vision is focused on quality through successful partnership with leading global diagnostic companies such as Kiagen, Revity, Nipro, and Sensure. So they have already a cooperation with a China company, yeah, I believe that. Okay, the next one is Segara Husada Mandiri. So Ibu, please.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Nama saya Sri Suparti. My name is Sri Suparti from PT Segara Husada Mandiri. We have manufacture and distribution, especially for product IVD and especially for kimia routine. And kimia routine for manual tests like hematology, urinalysis, stain, but for manual testing. I established from 2000. Thank you. Yeah.
Thank you, Ibu Sri. So Ibu Sri is the founder and the owner of this company. So you can contact her. She is a mother, but also a good entrepreneur. Okay, the next one is Cahaya Hasil Cemerlang Multi Manufacturer. Yes, please, Bapak.
Halo.
Boleh maju sedikit Pak, kalau enggak supaya kelihatan. Yeah.
Hi everyone, my name is David from PT CHC. So we manufacture medical equipment. So we based in Cikarang and we have 2 ISO 8 clean room for IVD, low humidity and ESD safe electronic assembly. So we focus in electromedical equipment, IVD, equipment, anthropometry, and hospital furniture. So that's our introduction.
Okay, thank you. Cahaya Hasil Cemerlang Multimaster. Selanjutnya, next one is PT Babat Prima Sentosa. PT Babat. I think I saw okay. He left probably. Okay, PT Babat Prima Sentosa is a company that distribute medical equipment in Indonesia. It has been operating since 1994 and involved in the hospital and healthcare industry. What I know about this company, actually, they focus also on the medical equipment, electromedical equipment. So if you would like to cooperate with PT Babat, then you can contact later on to the association, either Aspaki or Gakeslab. So the next one is PT Prodia Diagnostic Line. PT Prodia Diagnostic Line, anyone from ProLine? Okay, it's part of a Prodia group of companies. So if you go around to Indonesia and even in Jakarta, you can see a lot of clinical laboratory called Prodia. So Prodia is a private laboratory as well established and so-called probably, if I may say, is a market leader here. But they also expand their business to the manufacturing IVD, in vitro diagnostic. They have 10 years experience. The product portfolio comprises of ready-to-use clinical chemistry, immunoturbidimetric reagents with high performance stability, various hematology analyzer, instrument assembly for clinical chemistry, hematology, etc., etc. So if you see, so if you would like to get a good IVD manufacturing and also a downline, which is a distribution and a clinical, you can contact this company, which is PT Prodia Diagnostic Line. The next one is PT Kalgen DNA. Yes, Ibu, please.
Hello, everyone. Good afternoon. So it's an hour to represent our company, Kalgen DNA. So Kalgen DNA is an in vitro diagnostic manufacturing company focusing in molecular diagnostic for oncology and infectious disease. We are established in 2012, and we are part of the integrated solution from Kalbe Group, a largest pharmaceutical in the leading pharmaceutical company in Indonesia and the largest publicly listed pharmaceutical company in Southeast Asia. So under Kalbe, we have a complete ecosystem for the diagnostic, from the research and development, manufacturing carried out by the Kalgen DNA, and then we have the CRO to deliver the clinical validation if you need to. And we also have the distribution and marketing for medical devices, as well as the clinical laboratory to deliver the lab service to the end user. So for the Kalgen DNA itself, the manufacturing company, we already obtained the GMP for the medical devices and also for the ISO 13485 certification. So it is ready for the export market. So having all those complete ecosystem, we are open for collaboration from research, production, including the toll manufacturing, as well as the commercialization. So we're looking forward for further discussion for the collaboration, and thank you.
Thank you, Kalgen DNA. Big applause to Kalgen DNA. The next one is PT Wanjek Indonesia. Someone for Wanjek? Oh yes, Pak Dede, please.
Good afternoon, everybody. My name is Dede Kosnendar. PT Wanjek Indonesia established in 2003 when the WHO changed the disposable syringe to auto-deliverable syringe for the safety injection. Firstly, we produce only 100 million, per year. Now the capacity is 1 billion per year. And when the pandemic in 2020, we helped the government for the pandemic. And nowadays, we also produce other products such as IVD and then blood bag, etc. Thank you very much. Yeah.
Thank you, Pak Dede. Yeah. So Wanjek is one of the leading manufacturing for syringes, and they are also appointed as a partner for UNICEF, ya Pak Dede ya. Yeah, UNICEF for immunization program. So the last one probably from the industry is PT Forsta Calmedic Global. Yes, Pak, silakan.
Okay, thank you. Good afternoon, ladies and gentlemen. I'm represent PT Forsta Calmedic Global. Forsta is part of Kalbe Pharma Group. We are focusing manufacture medical device and diagnostic manufacturing. And right now our product line is surgical sutures, media, culture media, X-ray, dialyzers, and soon in the futures we are preparing for CT scan, MRI line. And We are locating in Jakarta, in Pulau Gadung, and the company has been established since 2019 and get some certification, CPAKB, ISO 13485, and also halal certification. I think that's it. Thank you.
Thank you, Pak. From Forsta, give big applause for Forsta Medica. Thank you. I believe that's all for the healthcare industry from Indonesia. Next one will be the association. And with an honor, I would like to invite Pak Imam and Pak Irwan Sutresno probably. Better you go forward to accompany me here and explain about your association. Pak Irwan, Pak Imam. Thank you. Pak Imam, sini Pak. Yeah. So the first one will be Aspaki. So I will let the chairman himself explain about Aspaki. Silakan, Pak.
Thank you, Dr. Randy. Good afternoon, ladies and gentlemen. Let me introduce myself, Imam Subagio, as a chairman of Aspaki, Indonesian Medical Device Association, specifically for manufacture. Our association established starting from 1999, already old, yeah. Currently, we have the members about 210 members, and like the AB3O, that our member also from the small business, medium, and also big company. Some company already explained to us, yeah. For example, OneJack is the big company, Kalbi Group also big company. And also we are doing the cooperation with China actually, China Association Medical Device Industry, CABC, maybe you know CABC, that our association already cooperation and make some communication from some event. Today, I only 1 or 2% from the association team, because mostly from us currently at Dubai in the Arab Health event currently. So hopefully we can open to cooperation with delegation from China today. Of course, for the some collaboration about the transfer technology and also the component part and another thing, and also the education. If we need some member need the R&D and also the clinical laboratory, of course for the some member, maybe the product related with your business. That's all I think for Aspaki. Yeah, welcome to Indonesia, and we can go cooperation. Thank you very much.
Thank you, Pak Imam. Next one will be from Gakeslab, Pak Irwan Sutresno.
Hi everyone. Let me introduce. My name is Irwan. I'm the Vice Secretary of Gakeslab. Gakeslab is an association of Indonesian Medical and Laboratory Appliance Enterprise Association in Indonesia. Who are the member of our association? One is distribution company. We have 1,500 members. Yeah. And then we have a manufacturer company, local manufacturer company. And we have a multinational company like Abbott, Siemens, Mindray. Yeah. They are also our members. Yeah, we have 23 branches in Indonesia. So we are the largest association in Indonesia. Our member all around Indonesia. So if you establish or set up the company in Indonesia, don't forget to join with us, with Gakeslab. Yeah, we can discuss together. We can grow together. Yeah, in under association of Gakeslab. Thank you.
Thank you, Pak Irwan. Last one but not least, Hipelki. Hipelki, I think I'm the one who has to explain. Please introduce IPLKI. IPLKI is a Medical Device Industry Ecosystem Association, just recently established in November. The idea is to combine all the element of the ecosystem, which is consists of researcher, universities, science technopark, also the startup company, industry also there will be the member is include the component, machinery, raw material industry, CRO, lab, clinical lab testing as well is a member of this association. And also until the end of the road is actually is a distribution, after sales service, etc. On top of that, certainly the member have to be equipped with the one who has a financial, which is the financial technology, venture capitals is also a member of this association. So the idea is the association have to become the partner of the government. So if you think the triple helix, academician, business, and the government, this is the closed loop of that ecosystem. So yes, if you would like to know about the Indonesian market, about the element of the ecosystem of industry, please contact IPLKI. And that's all about the Indonesian market, Indonesian association. And then I will give a hand back to Emma. Please, Emma. Thank you.
Thank you for the introduction from the Indonesia side. Given the times that we are closing to the section, if you have any further question regarding to the medical device registration, feel free to follow up offline or ask question. And you meet some of the colleagues here, feel free to exchange the contact information. You can also find all the presentation in the link that MOH has shared on the screen with the QR code. There is like all contacts there, so feel free to reach out. So without further ado, I'd like to thank everyone for your participation for the section. Thank you so much, and we'll pass the floor back to the MC. Thank you so much.
Thank you very much. Give a big round of applause to our panelists for the last session today. Thank you. All right, now as we are finishing our last session, it marks the end of our agenda today. Once again, thank you everyone for gracing your presence with us. We truly appreciate it. And please be informed that there will be a dinner in Sato Restaurant starting at 9 p.m. So you have, sorry, 6 p.m. Sorry. Okay, so the dinner will be served on 6 p.m. So you will have 1 hour free time after this. Please have yourself a coffee break in front of the meeting room. So on behalf of the organizing committee, I would like to apologize for any inconvenience throughout the event. For the all materials or the company profile of each companies, you can scan to the QR in front of our meeting room. And now, thank you very much. I am ending my duty as MC today. Thank you. Have a nice day. Assalamualaikum warahmatullahi wabarakatuh.